Paul's just gone for. Are you happy if I go ahead and start?
Okay, Karen, thanking you.
Okay. Members, you are hereby summoned to attend the virtual meeting of the Health and Community Committee on Thursday, the 22nd of July, 2021 at 4 p.m. So I'll commence firstly with the roll call. So Alderman Devaney.
Karen. Here.
Alderman Guy. Alderman Kerrigan. Councillor Sonoya Barr.
Here, Karen.
Thank you. Councillor Boyle.
Is that John or me? Sorry.
Sorry, Michaela. Sorry.
Yeah.
Okay. Councillor Burke.
Sure.
Councillor Carr. Councillor Duffy.
And Shaw.
Councillor Edwards.
And Shaw, Karen.
Councillor Farrell.
Here.
Councillor Ferguson.
Here, Karen.
Councillor Fleming.
And Shaw, Karen.
Councillor Harkin. And Councillor Tierney.
Apologies from Councillor Tierney.
Okay, can I just do a double check then? Councillor Harkin, not in attendance, and Councillor Carr, not in attendance. Okay, that's great. Thank you.
Is that okay, Karen? Aye.
Yeah, Chair, that's me complete.
Okay, Karen, thanks. And these are all very welcome, folks. And if I could just read the statement of remote meeting, please. I would like to remind everyone who is in the remote attendance that this meeting will be broadcast live via the Council's YouTube channel and will be available for viewing by the public and media. The broadcast will also be available for repeated viewing at a later date. This broadcast may be terminated or suspended in accordance with Council protocol. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. By participating in this meeting, you're consenting to being filmed and to the use and storage of those images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. A copy of the Council privacy notice may be found on the Council website, www.garystraban.com. Thank you. And in relation to item 4, members, a declaration of members' interest, and if members want to do that now, or through the chat box, or when the issues arise. For myself, if I could declare interest in items 12 and 20. Items 12 and 20. And moving on, members, and I would like to welcome on your behalf a deputation today, which includes Mr. Tom Sullivan from the Chartered Society of Physiotherapy, Ms. Kate Lesler from the Royal College of Occupational Therapists, and Ms. Helen Smith from the Labour Relations Agency. And along with Tom Sullivan is a colleague of his, Ewan McComiskey, professional advisor. These are very welcome, folks, and welcome. And on the back of a motion was passed by Council, given the importance of the issues that you are going to address us on. If I could just say or suggest to yourselves and also to members that we will hear the full presentation from, and then obviously invite members, and what we would normally do is take our number of members, come back to yourselves, and then the number of issues that is raised by members, if that's okay. And if I could ask Tom Sullivan to address this first. Thank you.
Thank you, Chair, and thank you to Council members for
the invitation and the opportunity to present to you here today. I'll try and keep it as brief as possible. I'm sure everyone's struggling with the heat at the moment, so we'll try and be as efficient as we can. The presentation, yeah, that's it. Sorry. So from the beginning. So first of all, thank you to Derry and Strabane Council for the recent motion that was passed in May, I think it was, supporting the right to rehabilitation for everyone in Northern Ireland. We believe it is essential that rehabilitation is recognised as an unmissable part of the COVID-19 recovery. Services for the expected demand for rehabilitation and recovery of both COVID-19 and non-COVID-19 populations in adults and children are needed urgently. Sorry, next slide. So developing community rehabilitation has to be a priority for all of us. Rehabilitation makes people's lives better, yet many of those who could most benefit face barriers to accessing these services. The coronavirus pandemic is driving up need. At the same time, it can be a catalyst for much needed focus on how best to meet this. The challenge ahead of us is to translate this into new approaches to rehabilitation that is on offer in the community, better access for the public, and investment to make this happen. To bring about the necessary changes and investment in community rehabilitation, we need to work with all of those with a shared agenda in making this happen, including local government. Just to give you some background on the Community Rehabilitation Alliance that is operating in Northern Ireland, it's an alliance of charities and professional bodies who are all committed to campaigning for a right to rehab for everyone in Northern Ireland. The priorities for the campaign are to gain political commitment to delivering universal access to rehabilitation to meet needs, to improve the quality of rehabilitation through new models, better data collection, planning, commissioning and delivery of services, and to create public awareness across Northern Ireland of an individual's entitlement to rehabilitation for both COVID and non-COVID patients. As a result of the impact of COVID, the right to rehabilitation campaign started before COVID happened, but obviously long COVID and post-COVID syndrome have had an impact on that. So I'll just pass over to my colleague, Ewan McComiskey, who will give you some background information on long COVID, post-COVID syndrome, and the impact that that has in terms of rehabilitation needs generally. So I'll pass over to you, Ewan.
Thanks, Tom, and hello to our council members. Thanks for having us this afternoon. As you can see on the screen there, NICE, which is the National Institute for Health and Care Excellence, recognises long COVID as a clinical condition. And rather than a lot of other conditions that it recognises, long COVID or post-COVID syndrome is a collection of signs and symptoms that are often quite different in presentation from one person to the other. But what it is basically symptoms that occur for longer than 12 weeks and that cannot be explained by an alternative diagnosis. So it's a wide and broad-ranging list or appearance of these signs and symptoms. But what it is a multi-system disease. You'll have heard an awful lot in the press about it, but it is not just a respiratory condition. It can affect all parts of the person who's suffering from long COVID syndrome or post-COVID syndrome, can affect them in a multitude of different ways, including fatigue, breathlessness, dysautonomia, musculoskeletal pain, headache, gastrointestinal dysfunction, neurological symptoms, skin disturbances, loss of smell, taste. We could go on. There's an awful broad range of signs and symptoms, all coming under that one banner. And earlier this year, a couple of months ago, the ONS they produced data that linked to the number of people who are of COVID positive patients and how many of them are going to experience long COVID infection. So in Northern Ireland, if we extrapolate those figures, we can estimate that there are 21,000 people living in households in Northern Ireland are experiencing long COVID symptoms. That's an awful lot of our population. A report that was published out of Imperial College in London estimates that over a third who are diagnosed with those persistent COVID symptoms lasting at least 12 weeks, and that there's a huge impact on all aspects of their life. Now, we do know some aspects of people's presentation, and people are more likely to experience long COVID if they come in to their COVID experience holding a number of pre-existing conditions or lifestyle choices. So again, older age will impact on that. It will affect more women, people who are overweight or obese, people who smoke, people who live in deprived areas, or people who've had an admission to hospital because of their COVID. So we can understand a little bit of what's going to come into it, but the experiences that they have are very independent and very individual. Now, with over 136,000 people in Northern Ireland testing positive for COVID and huge numbers increasing by the day, there's an awful lot of people who are going to be experiencing these symptoms within our populations. If we go into the next slide, please. Now, what we're talking about in terms of COVID rehab is not just that acute response to COVID that you hear about in the hospital, so the number of emergency beds, the number of beds in intensive care or critical care, but that COVID tail of from the presentation of acute symptoms out towards 12 weeks and beyond 12 weeks creates a significant rehabilitation need for physiotherapists and other professions to be able to meet. But it's not just that in isolation, because we've got the acute COVID response, we've got that long tail of COVID rehabilitation need, but we've also got everybody else that's in the healthcare system that needs rehabilitation services. So people didn't stop having strokes or heart attacks or get new diagnoses of COPD throughout the COVID pandemic. These things continued, and a lot of their impact was impacted by the stretch and the strain that were put under the healthcare services because of COVID. So not only the COVID rehab response, but the indirect impact of COVID on other people's rehabilitation experiences needs to be drawn out and needs to be understood and needs to be resourced well enough to be able to deliver the outcomes that we want for our patients, for our communities. The CSP produced COVID-19 rehabilitation standards, which will help our services to be able to benchmark themselves against other services and provide the best possible treatment to the patients that need it the most. But those services need to be resourced appropriately to be able to achieve the outcomes that we want to do for our patients. And just before I finish, to hand over to Tom to grow out a little bit further, COVID is not a healthcare challenge or problem in isolation. Because of the impact on health, it will also have a knock-on impact on work or employment, on housing, on benefits, on education, so it is, and on finance. So it's not just a healthcare challenge. It has impacts right across all of the council's work and that of all local and national government. I'll hand you back over to Tom now.
Thank you for that, Ewan. Just to give you some background information as well, what's happening, the Department of Health response to long COVID. In June 16th, the Department of Health announced that they were putting in new services for treatment and assessment of post-COVID-19 syndrome, including the establishment of new multidisciplinary assessment services. The services will be in place across all health and social care trust areas and be open to referral from both secondary and primary care. It's anticipated that the services will be established by the end of October 2021. Now, the department announced that they were given funding of £1 million towards the development of these services. However, it's our view that this will not be anywhere near enough to provide the services needed for these long COVID, and additional investment is required. The other point that I would make is around COVID-19 and health inequalities. The infection rate in the 10% most deprived areas was a fifth higher than the rate in the 10% least deprived areas, and 2/5 higher than the Northern Ireland average. So the admission rate of COVID-19 cases in the 10 most deprived areas was almost double the rate in the 10% least deprived areas. Now, that has implications for Derry and Strabane. One, Derry and Strabane has the highest number of positive tests for COVID per 100,000 population. Two, Derry and Strabane has 5 out of the 10 most deprived wards, local government areas in Northern Ireland. So the implication there is that a one-size-fits-all service for long COVID will not work. So the implication is that because there are more areas of deprivation in Derry and Strabane, the conclusion is that they're going to have a higher number of cases of people suffering from long COVID, and therefore the council needs to have that discussion with health and social care trusts as regards to the resources that they're going to put in at a trust level to meet the need. So what can local councils do to help in terms of this? Well, first of all, thank you as well again for the motion that Derry City Council, Derry and Strabane Council passed, and your letter to the Minister and the Department of Health to ask that additional resources should be devoted to this area. We welcome your support for our Right to Rehab campaign. We would ask that as councillors you would continue to use whatever influence you have with your respective political parties to ask them to include a right to rehab in their health manifestos as we head into a Northern Ireland Assembly election next year. We've already started to do that. Just yesterday we met with the Sinn Féin health policy team to make the same point and presentation to them about the need to support the right to rehab. We also think that there is a role for council in terms of the resources and contacts that you have to disseminate the information and guidance that's already available from the CSP, from our colleagues in OT and elsewhere, and that we would be happy to provide the links to that and so that you can signpost residents in Derry and Strabane to those resources and other self-management resources that we would have on our site, and also resources that voluntary and community organisations who are part of the coalition have also developed in terms of meeting the needs of people with COVID and long COVID. And also then we would seek to ask that you would look again at the need in terms of putting a right to community rehabilitation into the council's community planning process, because the community plans for local government obviously were developed before the advent of COVID, and therefore there's a need to revisit, I would say, those community plans with a view to what can be done in terms of putting additional resources and help to respond to those who are feeling the impact of the consequences of long COVID. So at that point I'll stop and I'll hand over now to my colleague Kate Lesler from the Royal College of Occupational Therapists, and I'll look forward to any questions that you may have following the presentations. So thank you.
Okay, good afternoon. My name is Kate Lesler and I'm the professional practice lead in Northern Ireland for the Royal College of Occupational Therapists, and I would like to thank you, Chair and Council members, for inviting us here to the Health and Community Committee and for the significant actions that we've already taken, which I won't repeat because Tom has covered all of that. I think starting off, perhaps thinking about rehabilitation, it's something that any of us or our families might need at any time in your lives. And as I speak to you today, I'm sure many of you will know or have known someone who has undergone a period of rehabilitation. The situation we find ourselves in through life can change at any time. Sorry, I'm just, can I check about the slides? Are they available? Thank you. And I think all of us would want those services to be there when needed. So thank you for taking the actions you have, and for Councillor O'Neill for putting it forward. So what can Council do to support rehabilitation in the local community and support Council's own workforce who have been impacted by COVID-19? Next slide, please. You've heard it said that your health is your wealth. Society cannot prosper unless its people are healthy. But what does health actually mean? There's one definition which talks about health being the absence of disease, but I believe that may be a bit narrow and we may need to reframe this. People of any age can experience difficulties through injury, illness or disability, social issues or a major life change. Our population is living longer, and with that comes the increased risk of people living with multiple conditions. When we do face these issues, there may be times that we do need rehabilitation. And not many of us may have completely perfect health. I know I don't. But if we can aim for the highest attainable health, as mentioned here, and that should be for everyone, and as part of that, achieve a fulfilling life through the things we do every day. The relationships that we have are being able to participate in civic life, which is going to be of interest to you in the council. I think that is describing a quality of life, and this is also extremely important. And sometimes rehabilitation is needed if we face the challenges mentioned, which at a basic level is to help us get back, keep or improve abilities we need for daily life. But we also need to become informed as individuals about what we can do to look after our own health, first of all, and enable the communities that we live in. And that is why it is critical, and I really applaud you as a council for inviting us here today, because you can become very involved and there's much that you can do at that local level. We know many other things affect our health, and as a council you can support rehabilitation by beginning to tackle some of the social determinants. And these are the conditions in the places where people live, learn, work and play. It can affect a wide range of health and quality of life risks and outcomes. Unfortunately, health inequalities continue to persist, as Tom has just mentioned, as we see different outcomes for people in the most and least deprived areas of society. RCOT believes here is a need to understand and address health inequalities in relation to rehabilitation access and experience, so that those in greatest need are proactively supported and services can be delivered appropriately across Northern Ireland. Failure to meet rehabilitation needs of all the population drives the cycle of disability, poverty and health inequality. Some of the largest inequality gaps for drug-related mortality and misuse and alcohol-related admissions are in the Western Trust, which are over twice the local government district average. This is concerning and suggests there will be a higher demand for rehab services, especially as the impact of the pandemic becomes more apparent. And I'm just mentioning one thing there. By providing appropriate funding for services across Northern Ireland, the need for care will reduce and people will be able to live more independently. Next slide, please. You ask what you can do as a council, and I know you have already begun the process. You've already been looking at how to improve the health and well-being of your community, and it is a key theme within your plan. You have also been looking at information as to how the council area is affected by issues such as those who are economically inactive as a result of disability or long-term illness. And I believe Derry has got a city deal in February, and it's going to be important to get people into those jobs, into good jobs. Good work is good for you, is what we would say. And inclusivity is an important word in that. How are the people who need support to get into good work going to get that? Getting knowledge and information about where you are now is really important, especially following COVID. What has been the impact? As councillors, you're probably very much in touch with the situation in your own communities and amongst your own residents as to how well rehabilitation needs are being met at present. What are the issues now, for example? What are the housing needs? How many people are in wheelchairs? What is the prediction for homes based on disabilities? Are homes being built which include thought around future needs? What are people saying to you on the ground? What are people's lived experience? Where are they saying the gaps are? What is the situation in your care homes, often much forgotten? And how many have been affected by COVID and have they ongoing issues? And Ewan has referred to all of that. And thinking of the information that you want to gather is really important. And how is that linking up with the health and social care provision, which Tom has also alluded to, and other departments to ensure that there's going to be a whole systems approach? Next slide, please. I would say when you developed your plan, you were not aware of what was around the corner, not just one unpredictable event, but two. Brexit and the pandemic. So that has had a huge impact on everyone. And both of them have had such huge and significant impacts right across society. COVID has had lasting impact on individuals due to the pause in services and deterioration in conditions due to lockdown and deconditioning. RCOT would like to see new models of rehab provision which must be needs-led rather than condition-focused, with equal attention paid to physical and psychological needs. Occupational therapists, and I'm sure I'm also referring to all of my other allied health profession colleagues, can provide personalised support to individuals, as we understand that there is no one-size-fits-all approach in rehabilitation. These must be robust, multidisciplinary approaches that address rehabilitation effectively. Occupational therapists can use interventions to support those returning to work with long COVID and those suffering from extreme fatigue and cognitive disturbances. Our workforce will also be key in supporting those who are adjusting back into life after lockdown following an extensive shielding period. Next slide, please. So as you have recognised, there needs to be a rehabilitation framework to support service planning and delivery. And I would ask you as a council to pledge your support on an ongoing basis, and particularly with elections coming up next year, that rehabilitation and recovery are seen to be integral to the health and social care system and must be available for all who need it. There also needs to be a sustainable workforce to be able to provide these services. Allied health professions, of which occupational therapists and physiotherapists are part of, and other professions, the training is moving to McGee. There is a shortage of allied health professions, and we hope you will support our call for a more sustainable workforce across all of the allied health professions. In your City Deal document, you quite rightly support that for other professions, but we hope that you will ensure that allied health professions are also included. Next slide, please. So as a council, you can support your own workforce who have been impacted by COVID-19 and other issues. But looking at the environment people work in and access to perhaps ergonomic assessments if needed, or other ways of supporting good physical and mental health, such as taking breaks from screens through the day. And I will also mention here the condition management programme, which is a workforce focused rehabilitation programme, and some of you may well already be aware of this. It includes experienced registered healthcare professionals from a variety of disciplines, including occupational therapists and physiotherapists. And you may wish to invite them to come and speak to you at some point, and I can send over a short video to explain more. And I would also urge you as a council to consider what other support is available in this council area for residents, if you've not done so already, and who and how can people access these supports, such as in the community and voluntary sector. Is this information readily available? And what resources can you direct people to? Next slide, please. This is just a slide from the condition management programme, but it's to show that it also exists within your area as well. Next slide, please. So occupational therapists consider the relationship between what a person does every day, their occupations, how illness or disability impacts upon the person, and how a person's environment supports or hinders their activity. With this approach, occupational therapists help people to continue or re-engage with participating fully in daily life, including work, social activities, and maintaining roles and responsibilities. And Ewan was expressing how important those things were earlier. Consideration of planning and design of public areas and buildings can help greatly with social participation and accessibility. If someone is in a process of rehabilitation and environments and transport are accessible, this can support rehabilitation goals and participation. Are there places to go to? For many people, shopping may be the only exercise they get. Is it easy for them to get there? Are pavements suitable for people in wheelchairs? Do cars park up on the pavements? Are the pavements, are they accessible right the way through from one place to another? And if I went to Derry or Strabane, would I see with my own eyes people in wheelchairs or people with disabilities enjoying public spaces or using transport. I think that you can sometimes see how inclusive and accessible a place is by just looking around you. And have they, as a population, been included in all of your planning and design as you've been moving forward? These are important questions to consider for making people's lives easier and to make sure that they are included. These issues all fit in with the entire rehabilitation model and are key to everyone's health and well-being, especially as we all will get older and we need to be thinking of the public spaces that we will all be using in the future. Next slide, please. And this is just to mention there are resources on the Royal College of Occupational Therapists website, and I've just pulled up this one. It's how to conserve your energy, but you may wish to have a look there, or I can send through the links. Next slide, please. Basically, in conclusion, appropriate rehabilitation services are vital for our local communities, and it is so important to ensure these services are accessible for all members in the council area. And just to reiterate some of the points that I've made, it's about looking after our own individual health and having enabling communities, looking after those who we share this community with. And what's the extent of issues, the provision of rehabilitation, where are the gaps, the health inequalities, the social determinants of health, are we addressing those? And again, thank you for supporting our call for a rehab framework. We really appreciate that. And what are the other links from council to health and social care and other departments for a whole systems approach? What's already available in health and social care and in the community and voluntary services? Can people find these easily, and what are the access routes in? And finally, the environment is one of the most important areas that you can have a real influence on, and making sure that that's accessible. I would welcome any questions afterwards, but thank you so much for listening to my presentation.
Thanking you, Kit. And if I could ask Helen, in terms of the last presentation from the Labour Relations Agency, Helen.
Good afternoon, everyone, and thank you for inviting me along this afternoon. Apologies in advance, my camera isn't working, so unfortunately you're not going to see my pretty face this afternoon. Are there slides available, please? Thank you very much. I'm coming from a slightly different perspective this afternoon, and I suppose in the next couple of minutes I'm just going to spend or share with you a whistle-stop tour of our services and then invite questions. So for those of you who perhaps don't know who we are, our purpose is to improve employment relations, promote best employment practice, and resolve workplace disputes through the delivery of quality, impartial, and independent services. We currently employ the equivalent of 60 full-time staff who operate from 2 locations in Northern Ireland, our head office in Belfast and a regional office in Derry, Londonderry. However, since March 2020, these offices have been closed due to the ongoing COVID-19 pandemic, and all staff are currently working from home. All our services are being delivered by telephone and or video conference rather than in person at this present time. So next slide, please. The agency provides a range of advisory services, and that's to promote good employment practice and advise employers and employees on their rights and responsibility. So I'm just going to touch on a few of these in relation to long COVID and rehabilitation needs. So firstly, and probably the most important to those individuals facing that challenge at this present time, one of our services is the Workplace Information Service, and this is a confidential information and advice line for employers, individuals and their representatives. So if there are people out there who have issues around their employment, whether it be absence, long-term absence, performance issues, whatever that may look like, well then they can contact our workplace information service at any time, Monday to Friday, 9 to 5 p.m. As I've said, that's a confidential information line, and it is available for individuals, employers and their representatives. And we have a really excellent team of experienced and knowledgeable staff within that team who will answer queries to the best of their ability. In addition to that, we have all year round briefings, seminars, webinars and workshops, and these are aimed primarily at disseminating information and promoting good practice on a range of employment issues and enhancing the employment relations skills of line managers. We frequently produce practical guidance on emerging themes, for example, whether that be working from home or COVID-19 vaccination in the workplace. Those are just some of the recent examples of some practical guidance that we have produced, which are readily available on our website. We also work with key delivery partners on a range of events and signature projects, including developing guidance on important themes, for example, menopause in the workplace, which you may have come across in recent weeks. And that was produced in partnership with the Equality Commission for NI and the NI Committee of the Irish Congress of Trade Unions. And again, on our website, we have a document service, which allows employers to comply workplace documentation. And that may well be from written statements of employment particulars through to employee handbooks. And there's guidance and information on compliance and good practice. So I suppose the other side of the house is dealing with those problems that require dispute resolution. So we have a range of confidential services that deal with problems that may arise in the workplace. We work across all sectors of the province, and that's including public, private, education and research, voluntary and community sectors. And I suppose the most important thing is all our services are free of charge. Next slide, please. So finally, just to wrap up, for those people who are needing some assistance, some support, specifically if they are planning to return from work after being ill, and they maybe want just some supporting information and to be prepared for going back to work, well then they can contact our workplace information service and the details are there for you. I'm not just quite sure what those question marks are, but if the number isn't readily available on the screen, I can send that to Lorraine after the session today. And then of course our website address is there for anyone who would like to have a look at our website. So thank you very much again for the invitation, and if there's anything I can answer in terms of queries this afternoon, or indeed by way of follow-up links, I'm very happy to do that. So thank you.
Thanking you, Helen, and thanks also to Kate, Ewan and Tom in terms of the very detailed presentations and insights on an issue that is obviously going to be with us and have impacts on all of our lives for a long period of time. So as I suggested earlier, folks, in the aftermath of all of the presentations, members seeking to engage with our presentees. So I have a couple of indicated speakers. First of whom is Alderman Guy Darren.
You, Chair, and thanks to everyone for the very detailed presentation. Quite staggering, the numbers, the 21,000 experiencing long COVID, and no doubt these numbers will grow as in the coming months. But it must be about a year ago now. I listened to a young mother of two from the County Londonderry tell her story of how long COVID was affecting her everyday life. And the doctors had told her that basically they felt that it was the same sort of treatment as ME. Now, I know that they started treating her for that sort of effect, but is it basically, can I ask that in the pathway to rehabilitation that for long COVID sufferers, is the same route for ME sufferers being used more widely now, or is it still very much a tailored need for those affected with long COVID? Thanks again for the presentation.
I'm happy to start with an answer to that one, Darren. Thanks for the question. It's a really challenging one. So long COVID didn't exist 18 months ago. We didn't know anything about it. We're still finding out about it just now. I literally had an email into my inbox this afternoon just saying about a piece of research that's coming out of Kingston and UCL in London particularly around about long COVID. So we're still understanding what it is in terms of its presentation, the differences between it and ME. So, groups of symptoms that can appear very similar, but long COVID responds differently to those people who have ME. So therefore the guidance has to be different and has to be tailored to the individual. So both Tom, myself and Kate from the RCOT spoke about this. We cannot just rely on this one size fits all. That there are no click next kind of response to long COVID. It's a very personalised, a very individual response that we have to give people. And that's why, as Tom said, that the £1 million, although it seems like a good amount of money, actually in terms of the number of people that they're able to work with and how individual, how personalised that treatment response has to be, is a very, very challenging thing. What we're finding out about some of the patients who have long COVID is that the advice that they're given if they were presenting with ME symptoms can actually be dangerous to them in some, small numbers of cases. So we have to be careful that with the best intentions, we're not harming people further down the line. So it's a very, very difficult area to work in. And that's why we need that expertise. We need that resource in there to give these 21,000 and more, as you're saying, people the best hopes of rehabilitating out of this condition and then back into normal life. And as Kate was saying, whatever normal life looks like for them, if that is in terms of activity, sport, exercise, work, parenting, care for responsibilities, whatever that looks like, it's a very, very individual thing. And that's why we need to have that individualized, personalized rehabilitation offer for them.
Thank you.
Chair, can I just check that you still got connection, or have we lost you somewhere?
Sorry, Karen, my apologies. No, I was just saying I have a number of further speakers, and if the panel doesn't mind, I'm going to take 2 or 3 of them and then come back to the panel. And the next indicated speaker is Councillor O'Neill. Maeve, please.
Thank you, Chair, and thank you for letting me speak, as I'm not a member of this committee. But as a proposer of the motion, I just really wanted to just thank all the speakers for their excellent contributions. And I think it's really important that we're having this conversation because, throughout COVID, the focus has very much been on hospital numbers and people in ICU, but very much less so on the impact of COVID when people leave the hospital. And like, rehab is completely essential to enable people to love their lives to the full, but it's often these services which are an afterthought when commissioning services, or they get the leftover bits of money. But you know, rehab needs resource because it is labour intensive and it's time intensive, but it is, you know, essential for people to love their lives. And I think it's also really important to hear from the Labour Relations Agency in terms of for workers who are living with long COVID and wanting to return to work. And just to ensure that those workers are supported in their workplaces to manage their condition, and the importance of unions in supporting that process on their return to work. And I know that there's been a number of people in the health service who, you know, have gotten COVID from their workplace, and it's been a real challenge returning to work. But I think we really in council can't underestimate the importance of our planning decisions in enabling people during their rehab and also to just function as enabled citizens. It really is society which disables people rather than someone's own abilities. And like, you know, just a few examples. Yesterday I was on the Strand Road, and there was a gentleman at the bus stop with a Delta frame, which is a 3-wheeled walker, and he was really struggling in the heat to keep standing while he waited for the bus. And you know, there I was like, why is there not a bus shelter with a seat to enable someone to, you know, wait for a bus and not have to stand for too long? And I remember just last autumn, I was going out with someone an older woman who had had COVID, but she had oxygen on discharge from hospital, and we were going around one of the shopping centres here, and again there was nowhere in that shopping centre for her to sit down, and I hadn't anticipated that when bringing her in for a walk on a rainy day, and again I think of our like excellent parks like Brook Park, which is on a hill, and how do we enable people to access, you know, the beautiful cafe in that park who don't have cars but cannot walk up or down hills. And I think we do have a real responsibility as a council, given the massive numbers of COVID in our council area, but also the massive, this is coupled with the massive levels of deprivation in our area, which means that more people will likely be living with long COVID. So we have a massive responsibility as council to support those services in the statutory sector, but also the community and voluntary sector, that will, you know, not just get people out of the hospital, as I said, but support people to thrive within our council area. That's in a way that's really needs led, and you know, that's the design of our communities, the design of our, you know, city centres, our town centres, in a way that every citizen in this region can thrive. So thank you again to all the speakers, and thanks again, Chair, for letting me on.
Thank you, Maeve.
Sure.
Alderman Devaney Morris, please.
Thank you, Chair, for allowing me in. And on behalf of the DUP, can I just welcome Tom, Kate, Helen and Ewan here to the committee, and a very, very detailed presentation, as one of the previous speakers have just said. It's very, very timely for to have this discussion and around rehab. And, you know, when we're starting to move partly out of COVID and look at how recovery is going to be for those who suffer long COVID. And I do appreciate you and the analysis of all that there. We haven't got all the detail and the nuts and bolts and around that there, as quite rightly said. I do agree that you know, every citizen in the council area has a right to rehab, for no matter what reason that may be. Yes, I take it on board the issues in around deprivation, and the discussions that are around, we do have the highest positive cases per 100,000, and it is worrying. I do also take on board that, look, yes, I do agree that a more sustainable workforce is very, very important. And I also take on board that access for those with disabilities or even going through rehab and recovery is vital, because I just had a constituent spoke to me about a week ago regarding she broke her leg in an accident, and she is now in a wheelchair. and she was complaining about access onto our public transport. Now this is our local bus transport which was causing a problem, and I also believe that accessibility is vitally important, and quite rightly so. Planning and design is important for us as a council, and it's something that we have taken on board in certain cases, you know, access for people even with disabilities in our play parks, but it needs to have that broader discussion and around these issues. But look, I have no questions for you, but thanks for the presentation and very, very detailed.
I'll take one more, councillor, in this round, and then come back to the panel. And if we could invite Alderman Hussey, Derek.
Thank you, Chair. Like Maeve, I'm not a member of the committee and appreciate the opportunity. Can I say a very sincere thank you to all who have presented. Can I start in reverse order? Helen, totally and 110% agree with you. The infrastructural recognition of personal difficulties, challenges, is something that we can and should be addressing via the built environment that we create as we move along. Then moving to Kit. Kit, you talked in terms of the two unforeseen issues that arose, namely COVID and Brexit. I would appreciate if you could outline further the COVID one. You know, totally understand, totally okay with it, and understand the difficulties of OT, because I mean, for some time OT has been under-resourced, and I mean, those of us who try to get an OT out, you know, for a housing assessment or whatever, I'm well aware of that. But the Brexit one interests me. I'd like to know in what way you believe that Brexit has impacted on the service. And Tom, within your presentation, you referred to the £1 million that Robin is proposing, and that is not enough. Have you costed what would be enough? And could you possibly give us a figure? And I suppose it's always very easy to identify the issue without perhaps looking at what the solutions might be. And I suppose all resources are finite. And I would imagine that you're not saying to us that the resources have to come from within Department of Health, which is already stretched, as we know. So, you know, where do you see that extra resource that you believe, and I agree with you, is needed? Where do you see that coming from? You know, is it going to be increased taxes or whatever? I don't know. Or does it mean, for example, for Derry City and Strabandis Council, we abandon our wishes on the A5 road, and that money has to go in to the, you know, it's always a question of balance. So if you could clarify that for me. Chair, I really appreciate the opportunity. Not a member of the committee, but do thank all of those who have presented. Thank you.
Thanking you, Derek. And if I could invite the presenters in terms of the order they would have spoken. So if I could come to Tom first in relation to speakers so far.
Yeah, thanks, Chair and Derek. The issue of finance is, you know, within health is a recurring problem. We see almost daily debates and discussions in the non-executive about the budget. The £1 million that was allocated by the Minister, Swan, came from monies due to the June monitoring round, and an assessment was made at that time to begin to put in place these assessment and treatment centres, which we hope are going to be operational by October. How that will break down in terms of the numbers of staff in each area, they're still working out the detail of that. But we sort of estimate roughly that could or would amount to perhaps maybe one full-time physio for each trust area. Now, that really will not be enough to cover the demand that we expect. As regards where the recurrent funding for that comes from in the future, again, I think it's an issue that will be played out within the executive, and I think what we have done and what we have asked the department and the Northern Ireland executive to make more funding available to the minister than there currently is, and we would obviously very much support the minister in the calls that he has made himself in the Assembly for additional resource, because the amount that he has been given by the executive at present will not be enough to cover all that he is attempting to do in terms of rebuilding services and putting in place additional services, putting in place advanced practitioners to sort out the elective care waiting time situation. I mean, all of that at the end of the day is going to require additional funding, which has to be a collective decision by the Northern Ireland Executive. The other point that I would make in relation to the point that Maeve raised about commissioning, and it's a very interesting point that you raised, Maeve, about how these services are commissioned and ultimately how they're funded. You may be aware that at present the Health and Social Care Bill is going through the Northern Ireland Executive. Basically, what it will do is abolish the Health and Social Care Board, but it will also abolish the local commissioning groups in each trust area. So what they're consulting on at present is a model, an alternative commissioning model that is going to be put in place. And obviously the body responsible for the operation of that commissioning model will decide how resources are spent and what services are commissioned. The point that I would make to yourselves as councillors, the local commissioning groups previously would have had a very strong representation from local government on those local commissioning groups. It's unclear at this point in time what sort of representation there will be for local government on those new commissioning arrangements. And I would ask that you would respond to that consultation to ensure that there is very strong representation for local government on whatever new commissioning body is formed out of that, to make sure that your voice is heard, to make sure that you have a voice in terms of how those resources, how those services are going to be commissioned in the future.
Thank you, Tom. Ewan?
Yeah, just a small kind of addition to what Tom was saying, and thanks very much to Derek for your question. You said, you know, is this the money going to be coming out of the Department of Health? And yeah, every penny's a prisoner in the department now, as more than ever. But like I said in my presentation, COVID is not just a healthcare challenge in isolation. Yes, that's where we're seeing it at the acute response phase that we're in at the minute, that will continue for a little bit longer, regardless of restrictions easing. This is still an acute healthcare problem to manage, but not in isolation. Because if we don't get that acute and then that tail of response right to COVID patients and provide them with the appropriate rehabilitation, these people will struggle to get back to work or back to meaningful employment, be that paid or volunteering or caring responsibilities. They may struggle to be able to bring money in. If they're struggling to bring money in, then they may not be able to pay taxes. So it's a much broader context in this. And we see the impact we've all had it, you know, directly or indirectly in terms of education. So if we can't get kids at school and staying at school, providing them with a good positive learning environment because of COVID, then that has an impact on our workforce in years down the line. So this isn't just healthcare in isolation. And I know that you know, Robin Swan has spoken about that in the past, that it does need significant input from other sections of Stormont to be able to make this work. In terms of, you know, priority over other aspects in Derry and Strabane, I'm down here in the southeast of Northern Ireland. I wouldn't dream of saying what should take priority over another, but it's a really wicked problem because it does need money, but we need to think about the long game of this. This isn't just an acute response. This is the long term. When COVID leaves our shores, the impacts of COVID will not. It'll continue for a bit longer, and we need to be aware of that and resourcing things appropriately to make sure that we give our citizens the best hope that they can do in terms of moving out the other side of it.
Thank you, Ewan. Kit, please.
Thanks for your question, Derek. And maybe I'll take the one that you had asked about Brexit first. and about how that was seen to be a big issue, as well as COVID. And I think, for us as healthcare, with healthcare provision, we would like the focus to be on that. And Brexit has taken a lot of focus away to other issues in and around how that is going to be worked out. And it has caused, perhaps a disruption with different opinions within the political system. And, when you're looking forward to a stable environment where you want to focus on the issues that are important to people, such as their health and well-being and the provision of rehabilitation, this is something that has maybe, taken away from them. And I suppose that's where I would see it as having a somewhat a disruptive effect on the services, perhaps in terms of the provision of how they're actually been worked out. At that time, we're looking at the programme for government. We're looking for, you had done out your plan of action for that time. And I think that, most people would agree that that is probably taken away from that in terms of being a distraction, and political efforts have perhaps gone into other areas and have not been as focused on the issues that we need to be focused on for our populations, which is around, the provision of services and ensuring that we have a stable government to provide that. You'd also mentioned about homes and housing and about occupational therapists being available. And I know within the Western Trust that is an issue that does come up. And I suppose maybe what I'm talking about today is perhaps turning that up on its head a little bit and actually having the homes for the future, so that occupational therapists could, not have to be brought into those, so that we could maybe redirect their energies more efficiently somewhere else. So if you thought of the homes and the environments as being accessible, therefore you would not perhaps have to have an occupational therapist to come in to look at how that environment could change. And those are the ways that perhaps we as a profession could engage perhaps more with the councillors, because I think this is a great opportunity with community planning, that we could actually engage more with the council in terms of looking at how you could sort of like bring that down to the local community level, and how could we sort of input into that, and how could people who have disabilities, who actually have all of these needs, how can they actually input to whatever planning that you're doing to make sure that the needs are for them. I mean, Maeve mentioned an excellent example there of a man going to a bus stop and there was no seat for him. How do we get back to thinking about things so that people can get out into their environments? That then supports their health because they're out and they're active. It's a kind of like a circle, and unless we keep all of it going, it can get disrupted in different places, either that be Brexit or the fact that we haven't thought about the planning and the design of what we're actually putting into place. And and I have had occupational therapists say in the past that something is built, and after it's built, they ask occupational therapists to come in and look at it. So that shouldn't happen. You should not be waiting. Environments should be planned in advance. Schools should be planned. You will know as a council area, what's the likelihood of who's going to be going into schools, or if you're going to be building a school or another public amenity. Have you actually consulted with the people who may be able to help you with that? I hope that's answered your question and covered that.
Chair, could I make another point just?
Go ahead, Tom.
Just in relation to the, I suppose the two issues are sort of related in terms of Brexit and workforce. We are currently, and our OT colleagues are the same, experiencing extreme challenges in terms of recruiting physiotherapists in Northern Ireland. What we found in 2016, when the referendum result occurred, subsequent to that, we found that the number of registrants on the Healthcare Professions Council from European countries decreased by about 96%. So we don't have as many people from Europe registering with the HPC, the Healthcare Professions Council, which is our regulatory body, to work in the UK. And so, we're in competition essentially now as well, because the situation in the Republic of Ireland, and Derry and Strabane being a border county, the situation in terms of attracting workforce is quite difficult at the moment, in that the physios in the Republic of Ireland, or the health service in the Republic of Ireland, is exactly the same position. They don't have enough physios to fill the vacancies that are required, and are actually starting to target or try and attract physiotherapists from England, Scotland and Wales and Northern Ireland.
Okay, Tom, thank you. Helen, from yourself, in terms of that first round of councillors, any?
Certainly, you know,
Yeah.
there is no doubt that there is a sense and heightened sense of anxiety, and you know that's stemming from the pandemic, but also the challenges that many people have experienced, never mind those people who unfortunately have got COVID and perhaps transpired into long COVID. You know, certainly from an employer's perspective, if they're returning to work, you know, that's going to require careful and sensitive management. And, you know, it's really down to an employer to, I suppose, try and listen to what those employees are saying to them and accommodate them as best they can and be sensitive to their needs, you know, because not only are they dealing with the illness, but, you know, the long-term effect of the pandemic itself is likely going to escalate mental health issues. And I think we're all very aware of that. And, you know, that's something which is very front and focus of our minds at the moment. We run a webinar this morning, and there's a pre-recorded webinar on supporting mental health in the workplace on our website. And, you know, again, I can only urge people to tune into that at a time convenient to them and listen to it, because unfortunately, there are going to be mental health issues as well as long COVID coming down the tracks, and employers just need to be very aware of those issues that's coming and deal with those sensitively, because there is a possibility that some of those will amount to a disability, and there may well be a need to make reasonable adjustments. There may well need to be risk assessments continually carried out to assess those needs under health and safety. So it's very important that employers are alive to those issues, but also be alive to the risk of discrimination claims. And obviously the Equality Commission of Northern Ireland deals with those issues around equality law. And again, there is an advice line within the Equality Commission, and I'm very happy to share that telephone number with Lorraine at the end of this session as well.
Thank you, Helen. Appreciate that.
Chair, I wonder if I could make a final point just on the back of what Helen said there.
And I don't want to cut across, but I'm going to go on to, there's 4 councillors sitting within here, and
okay,
I'll come back around yourselves. So if I could ask you to hold it to them. The 4 councillors that I have as councillors: Ferguson, Duffy, Hargan, and Boyle. So if I could ask Rachel, please.
Thank you, Chair, and thank you to everyone who presented today. Tom and Ewan, my question was around long COVID, and Alderman Hussey has actually asked it, was around about the anticipated cost, because I took it for granted until today that it would be included in the overall COVID health, that, you know, rehabilitation would be included in that. And where I do see the positives of the £1 million, you know, my very quick sums here is working out that 21,000 patients currently presenting, that's only like £47 per person. So I appreciate you highlighting that, and I will do what I can to lobby on your behalf and on our side of things. Kate, again, occupational therapist, I have to say, as a lady who has a mother-in-law who's a retired occupational therapist, I completely appreciate the work that you do. And it isn't just around, you know, inside the house, and it's giving people independence. I have a constituent here who was in a wheelchair for 10 years and had to be, you know, helped across to the Women's Centre to do a course, and the simplest thing, a drop curb, allowed that person to have their independence, and the smile on her face whenever she was able to leave the house and go to the Women's Centre by herself. So having something like that, I think, like our accessibility officer in council looking at all our projects, is definitely important. You know, we have a play park right here that we have to retrospectively fit with equipment for children with special educational needs because it wasn't thought of. So 100% behind your campaign there. I think it's everything needs to be accessible and thought through how that would impact someone in their life whenever we're doing future projects. Helen, the LRA, again, you do great work, and I do send a lot of people your way whenever they're really struggling, and I think it's a great service. I had one real question for yourself. It was just, would you anticipate any new policies that are needed to help with the after effects of long COVID and getting back into work? And obviously, you'll probably be getting a lot of questions, and I know it'll tie in with occupational health, but it's that return to work. It's that kind of adjusting things. Do you anticipating policies like council needing new policies in place for people coming back in with long COVID? But again, I appreciate all your work and I appreciate all the presentation today, and thank you very much.
Thanking you, Rachel. Councillor Duffy. Sandra.
Thank you, Chair, for allowing me in, and thank you to everyone for the presentations. I have to say they were very informative, and even as the discussions have developed, a lot more information has come out. So I have really appreciated that in terms of my own understanding of things. We talk about long COVID, and we talk about the long list of associated symptoms, and we're just, as you say, just now coming to some sort of understanding of it, and it is evolving all the time in terms of additional symptoms being added and where people are at with it. So do you see, just in terms of the resources needed, I mean, you did meet with our party reps. I think we said yesterday in relation to it, we have been on record as well in calling on the health minister to ensure that there are resources available for rehab and for addressing the issues surrounding long COVID. There is a long list of competing priorities within the health service, yes, but as we're coming out of COVID, we are well, hopefully coming out of COVID, we're seeing this magnitude of additional health issues coming at us, not least in terms of the mental health issues that we're already currently dealing with, but then the physical health issues that are coming from people who have had COVID or are now suffering long COVID. Probably I feel that COVID has really shone a light on the health inequalities that were already existing within our communities, and has really highlighted the issues that were already there and exacerbated them. I suppose that many of the questions have been asked, but just one that has struck me is around we're talking 21,000 people at the minute. I would actually question that figure and ask, do we feel that there would be quite a high number of people who would be suffering from long COVID symptoms who wouldn't be diagnosed? Because I know from talking to quite a few people myself, they have no diagnosis of long COVID, but they would talk about continuing symptoms. They would talk about their brain fog. They would talk about different things that seem to be symptomatic of COVID. When they recovered from the initial symptoms of COVID, these symptoms have languished with them. So just a question around that. And then how, as employers, do we get to grips with that and make allowances to ensure that we can get people back to work? And probably just following on Rachel's question there around making sure that our policies and procedures within the workplace can capture all those needs. I suppose that's it, but just to thank you. I really enjoyed the conversation today, because I have felt I have come away with a greater understanding. So thank you.
Thanking you, Sandra. Councillor Harkin. Sean.
Thank you, Chair, for letting me in, and thank you, and Helen, Kate, and Tom for your excellent presentations. And you know, it's very, very educational for us. I think I'm glad that our council is having these discussions, because it allows us, obviously, the campaign here as a local council around many of the issues that you're advocating, but it does allow us to try and shape our party manifestos as well, and we'll be happy to incorporate many of the proposals that you had for the council into at least People Before Profits manifesto. And I know Maeve O'Neill is helping to shape our approach to this as well. And we're learning along with everybody else. But I think the first thing is that this has been recognised and established as a real condition. And I think we have to be on the front foot in terms of responding to people who are impacted and putting the resources in place. And there's a couple of points that I wanted to make on it. One is, rehab is tremendously resource heavy, right? And often that is a reason for not investing in it. But if you don't invest in rehab, the problem then re-emerges further down the line, and it becomes far more expensive for the health service. And this doesn't just apply to long COVID. This applies to everything. We need to reorganise the health service so that there's prevention's put at the centre of it, rehab is put at the centre of it, and that will save a tremendous amount of money for the health service, I think, but it'll also have a massive impact on the well-being of many, many more people who will be able to enjoy fuller lives as a result of that kind of approach. And so there is an issue of money, right? And I think that we've seen throughout this pandemic that when money is needed, it can be found. And so whether that is Westminster finding tremendous amounts of money, which exist there, or increasing taxes on the super wealthy who have, as we've seen over the last year and a half, got even richer while everybody else has stayed static or fell behind. So there's more wealth that can be pulled into the service of greater society. I think that Stormont doesn't have great tax raising powers, but I think that there are ways that Stormont can tax the wealthiest and tax corporations more here, and that would help resource and fund the health service. Or if we have an All Ireland health service, I think that we can imagine how that would be. We can raise funds, through on an All Ireland basis to do everything that we need to do, if that for a more rational health service. So those are just a couple of points. I mean, Kate mentioned, and I think that this is very, for me, this is very important. Look, Kate said planning is very, very important, and planning and the chaos of the private sector, I think, don't go together very, very well. And this is why the health service is so important and so important for us all to defend, because clearly there are forces at work in Westminster and even here that want more and more of healthcare to be addressed by the private sector. And that's going to create chaos. And look, private companies are going to chase profits, which means that they're not going to be set up to cater to those who are most in need, who maybe can't afford the most expensive treatments that are out there. So I think in terms of thinking about long COVID and planning and rehab, we have to be thinking about properly resourcing the entirety of the NHS, and that does mean pushing back against privatisation that is going to be completely disruptive and create, we're already heading in the direction of a two-tier system. So that's very, very, very worrying. A proper planned out, that the health service is about planning about how to address the needs overall in society. And then the last thing I wanted to say, and I'm going to make a proposal on this that maybe we can address after the discussion, is look, for all this to work, we need the people who are the health service to be there. And I think it was Kate mentioned, and maybe you mentioned it as well, that look, there's a massive workforce shortage across the health service right now, which has put strains on our ability to take on this new work in terms of long COVID. And there's a real crisis as well when it comes to the allied health professionals. There's a massive shortage there. And our health service is not going to attract people if they're not properly paid, if their terms and conditions are being ripped up and destroyed. And if agencies can offer people a lot more money without the same kind of benefits, and that's where we are right now. And I think, look, I believe that our health service workers are heroes. I think many people would agree with that. But the proposal that's been put forward by Boris Johnson for health service workers in England of a 3% raise, I think just is a slap in the fist, to be quite honest. And we can't further demoralise health service workers with paltry pay offers, because people won't join up. We won't have the expertise. coming in to carry out these vital tasks. So I think as a council, we should be sending a message to Boris Johnson that that should be rejected, and Stormont shouldn't be planning to follow suit with kind of such a paltry, shouldn't be planning to endorse such a paltry wage, because I don't think any of this will work in terms of plans for the health service unless the people who are the health service, our health service workers, are actually properly resourced, respected in terms of their pay and their conditions. And that's what's going to make the health service survive and be able to address all these massive challenges going forward. So I'm just going to put that into the chat box now. Thank you, Chair.
I have two more councillors to speak, panel, and then I'll come back to yourselves. Councillor Boyle, Michaela.
Yeah, thank you, Chair, and thank you to everyone presenting here this afternoon. I suppose just Tom in some way addressed my comment or question in terms of resource and capacity when he was talking to Alderman Hussey. And I suppose just in terms of allied professionals, in terms of speech and language therapists, osteopaths, chiropodists, podiatrists, dietitians, we do need to encourage a lot of our young people to take a career in this area and to make them graduate ready to live, work and stay here. And I suppose it was just, a question around that on what is being done. And I mean, I understand within career days, within schools and all of that, and third level education. But I think, and I always say this, no matter what professional that we're talking about, I think we need to have a conversation in schools with young people and make them ready and make them prepared for the world ahead in terms of a career in this regard and allied health professionals. I just want to make the comment also, I was in a place yesterday, a healthy living project place, and I saw a wheelchair and a commode sitting there, and I think when we talk about how communities can help, a lot of people are sitting in homes waiting on wheelchairs and commodes and other aids. Very, something very simple maybe, and and obviously waiting, particularly around COVID, waiting for someone to come out and justify their need for an aid, particularly a wheelchair or a commode or something like that. And we're not talking about people with long-term disabilities or illnesses. We're talking about people who are obviously coming out of hospital due to operation or whatever, that needs it for a small period of time. So I seen this in a community setting yesterday, and I asked, and it belonged to someone who obviously is no longer with us, and the family gave it over to the community if anybody needs it. And I think something as simple as that can be done to make a difference to someone's life in a community is something we should certainly be supporting going forward. We talk about how communities can help and the value of community workers. Well, that's one area where they can assist and people within their own communities looking for these aids that, if there was I suppose a shortage of these, or if it meant that we were waiting around a long time for someone to come out, that there's somewhere to go and say, could I have that wheelchair? Could I have that commode for a week, a fortnight or whatever? But those are the simple things that make, people's lives a lot better and more meaningful. But it was just in and around how we get people to live, work and stay here that have graduated, and how we get people into the career of allied health professionals. Thank you.
Thank you, Michaela, and Councillor Mooney, Sean.
Thanks, Chair, for allowing me on. Even though I'm not a member of this committee, but I'd like to thank the contributors, Tom and Ewan and Kate and Helen, for coming on today. I had the opportunity of speaking on Maeve's motion there when it was brought to Council, and had the opportunity to do some research into the motion itself. And it's quite obvious that prior to COVID, the rehabilitation services were under pressure, and coming through COVID now, there's going to be even more pressure put on them, and resourcing is going to be a fundamental aspect of going forward and trying to get through this. But obviously the questions I have been asked already by fellow members, but I picked up one point which Helen said from the LRA, and in relation to employers having to be more compassionate and probably more sensitive towards employees who have long COVID and who are experiencing these difficulties. But a point that occurred to me is, what advice would Helen have for us members and for the advise maybe constituents who maybe contact us about those employers who are maybe less sensitive and less compassionate if they see an opportunity where an employer or employee is suffering from long COVID and they don't have the patience to perhaps keep them in employment? What advice would Helen have if somebody maybe brings us? Can we go to the LRA? Can we signpost them to yourselves, Helen, or would you have any sort of advice that we could maybe provide constituents in that regard? But thank you, Chair, for allowing me in.
Thank you, Councillor Mooney. Thank you, Sean. And if I could go back to the panel, and I suppose if we take it maybe in the same order, Tom, to start, please.
Thanks, Chair. Just a couple of points. One in particular that Michaela raised about, the workforce situation and attracting people into our professions, but also the issue that we have faced in Northern Ireland is about having a workforce in a particular area, and Western Trust has always been an area that has had difficulty in the past. I think that could be addressed partly by the relocation of the allied health professional undergraduate schools to McGee, physio, OT, podiatry, and I'm not sure, dietetics moving there as well. And I think that was part of the rationale as well for the location of the postgraduate medical school there, because there's a particular issue in the Western Trust about attracting doctors across a range of specialties to work in the Western Trust. And the rationale is that, well, obviously, if there are more people from that location who are able to access training, then the likelihood is that they're more likely to stay in that area. So you could see a knock-on effect from the relocation of those courses in attracting more people from that locality to train and then to stay and work in the Western Trust. The other issue about workforce is, I think, again, the example I would give is the Western Trust. What we've seen in recent years is the development of these first contact physiotherapy posts in primary care. The result of which was, again, the pressure that was on GP practices, particularly in the Western Trust, where we've seen the biggest decline in the number of GPs in that area. And I would suspect post-COVID, you're going to see a further decline, because there's a lot of doctors and GPs in particular who have been stressed out and might decide that it's to take early retirement. But what has happened in that these first contact physiotherapy posts, these are people, physios, who are working at an advanced practice role, who've been able to move into primary care to take some of the pressure off the GP colleagues, to act as a first point of contact for people with musculoskeletal conditions, to replace that antiquated model that we had in the past, where someone would go to their GP with a back, neck, knee, hip complaint, and the GP would say, I need to refer you to a physiotherapist. We have a more efficient system now. It allows the physiotherapist to demonstrate and use the skills that they're trained to do, to take that pressure off the GPs, to prevent onward referrals for diagnostics into secondary care, onward referrals to consultants, to reduce the vast majority of these first contact physiotherapists can also independently prescribe, and therefore they can also reduce the prescribing costs for patients and unnecessary prescribing. So there's a combination of things that AHPs can do if they move into these advanced practice roles. historically, the difficulty that they've had in doing that in the past is that the system still operates according to silos, departmental silos and professional silos, whereby where AHPs are represented at this point in time in the Department of Health, there is a Chief Allied Health Professions Officer, there's a Chief Nursing Officer, there's a Chief Medical Officer, there's a Chief Social Work Officer. But the Chief Allied Health Professional Officer is not represented at the same level as all of those other Chief Allied Health Professions Officer. And we have continually tried to lobby and campaign to get equal representation for allied health professions at the decision-making table. Now that happens in health, but it also happens at a trust level. So therefore, when these conversations are being had about what services are required and what services to put in place, often allied health professions are not at that table, and that needs to change. That's a structural change that needs to take place to allow our voice to be heard as well, to allow our input into those commissioning processes when they're talking about redesigning and rebuilding services.
Thanking you, Tom. Ewan, please.
Yeah, thank you, Chair. I just got three very brief points, if I may. So, somebody spoke about physiotherapy as a career and getting out into schools and you know, other careers events to try and promote that. Now, as the professional advisor for all of Northern Ireland, it would be now impossible to get out to all of those events, especially in COVID times. But what we do have is resources for the Chartered Society of Physiotherapy and for our members to go out and do that. So Maeve, as an example, could go out to those schools or careers events closer to her, and many others could. The other thing, and apologies, I forget who raised the question about the mental health impact of COVID longer term. Obviously, it's difficult to understand that because it's an unprecedented phenomenon that COVID has brought to us, certainly in our lifetime. But what we can do is learn from other disasters and other really significant events and what that has done. So the earthquake in Christchurch in New Zealand, which was just over 10 years ago now, they're still seeing now a 70% increase in mental health referrals for school-aged children, and that's 10 years after that event. And some of those children would have been very, very young when the event happened, but the impact still lasts on another number of years afterwards. So we need to be cognizant of that fact when we're planning COVID services, that it's not just in the acute phase, it could be years and years down the line. And then the last thing was around about the diagnosis of long COVID. Now, acute COVID, there's a blood test or a breathing test. We all know about them. You might have experienced them to diagnose you with COVID. There's no single diagnostic test for long COVID. So it's a very difficult thing to diagnose. And the diagnosis of it is actually the ruling out of other potential causes of those symptoms. And that can take a long time. So forgive me, I think it was potentially Rachel or Sandra who initially asked that question about it, but it can be a timely diagnostic process to get that long COVID or post-COVID syndrome diagnosis, because you're ruling things out rather than ruling one thing in, if that makes sense. What might happen in the future as we learn more about the syndrome, about those series of signs and symptoms, that we might be able to get better at diagnosing, but right now it looks like ruling things out rather than ruling things in.
Thanking you, Ewan, thank you. Kate, please.
Okay, thank you. Sorry. Again, about the careers, you have mentioned about getting people into the professions. And I do think that there are quite a number of people who want to get into the profession. In fact, it's probably oversubscribed. And what we have been suggesting as an organisation, that we have alternative routes into the professions. We have been suggesting something like apprenticeships or MSc in some ways that they have done that in other places. And I think that's something that perhaps council could also support us with in terms of looking at how we actually support this, all of these professions going forward, because we have to think of other ways to get people into it. And that would perhaps be someone who is already working as a therapy assistant, who might then start to do this apprenticeship alongside her job or his job. Sandra, you mentioned something about support for work, and someone else had mentioned that as well. And I would say again, the condition management program is something that you perhaps might want to look into or ask for someone to come and speak about. You can also self-refer through to that, and I will send Lorraine over a small link to that so that you'll be able to see how to access that. And I do know that COVID is probably having a different impact, and maybe different kind of guidance will be given to people for that. And it was also mentioned as well about the cost of not doing this. I think that, you know, we're aware of the impact that it's having on society, and it's not just people who've had COVID or long COVID, but it's the people who are not getting rehabilitation, which was an issue over and above all of this before COVID. You know, the services weren't there, and perhaps this is a time to change things. Perhaps now we have the opportunity to really take this and say, you know, we must actually change things, and people must get the rehabilitation. We all deserve to, you know, to live an equally high quality of life. And someone had mentioned, I think, again, it was maybe Sandra or maybe Michaela, about the care homes, or about going into homes. And I did mention earlier, you know, about having, you know, going in and seeing what's the evidence about what is actually happening. You know, what are the services that are needed, especially allied health professions, because there was some work that was to go forward with actually getting allied health professions, and I know occupational therapists, and I'm sure physios and speech and language, into care homes. But what has been happening with that, and why are we not giving a really strong message that elderly people or people in care homes deserve to have a high quality of life? You know, we do not want people sitting around, you know, and not having a meaningful activity. None of us would want to have that, you know, which I would call occupational deprivation. We would all want to have activities, things that are meaningful, and Ewan has also referred to that. You know, we all have responsibilities, caring responsibilities, or roles and responsibilities, or jobs, the education, and all of the things that we do every day. It's important that we take that seriously for everyone. And I have heard, you know, the people who needed rehabilitation before still need that rehabilitation, and there's more people have been added to that because they've deconditioned or perhaps de-skilled since COVID. You know, and I've heard of elderly people who used to go out in their car and do the big shop. That's all stopped. You know, you can imagine sort of the knock-on impact when they get back into the car again. Will they have the confidence, you know, as well as all of the things that have been mentioned here in terms of the mental health needs as well, that we need to consider. And there was someone has also mentioned wheelchairs, and I would say, you know, one size does not fit all, and we need to think about equipment and how that's also managed as well. Thank you.
Thanking you, Kit. And if I could ask Helen, please.
Thank you. Yes, just a few things I'd like to pick up on. In terms of new policies, absolutely. You know, there are policies literally coming out of our ears at the moment, in terms of new policies. But I think, you know, these issues don't necessarily call for new policies always, because employers should consider what other existing policies they have in place. So, for example, a return to work is likely to fall under an absence policy, and that may well just mean some tweaks to that policy. Now, again, if there is a recognised trade union within the workplace, well then obviously communication and consultation and negotiation is key. You know, so again, there are people within the organisation who should be consulted with and negotiated with, and that should be communicated. Certainly there are benefits of introducing policies, and I suppose some of those, you know, is about sending that consistent and clear message across the organisation, and that everyone knows exactly what is expected of them. And I suppose in terms of awareness training, constant training specifically to line managers, because at the end of the day, they're the first port of contact for any employee with an issue. And I suppose they need to be aware of what the policy states and how it should be implemented. And if they have any issues, who are they being signposted to within the organisation? But it's really, I suppose, policies are a means of communication, and communicating information. And I suppose, yes, there are going to be new policies, but if there are existing policies already in place, provided there are some tweaks to those in consultation and negotiation with representatives, whether it be trade union or employee representatives, well then there shouldn't be an issue with that. So it may well negate the need for a new policy on every single issue that crops up. In terms of Councillor Mooney's question around advice to constituency offices, I can only suggest Councillor Mooney signpost people to our workplace information service, and they will be dealt with in the most professional way, and their queries will be answered in the best way that we can deal with them. So the support is there. It's free of charge. It's entirely confidential. We will not be asking names. So we can only encourage people to use the free service that is available to them. In terms of returning to work, there is no doubt there is a hesitancy for all employees to return to work, regardless of whether you've been working from home like myself for this last year and a half, or you have been ill. You know, there is that hesitancy in returning to work, and obviously it falls on employers to ensure that they highlight and communicate the measures that have been put in place to safeguard the health, safety and welfare of all employees. They need to listen to their concerns and try and accommodate them in whatever way they can. And obviously any kind of working arrangements should be kept under review, whether that's a form of hybrid working, whether that's different working patterns to ensure people are safe within the workplace, and obviously queries and concerns. There should be clear messaging and clear signposts to people who can deal with any queries or concerns that crop up. That's me. Thank you.
Thanking you, Helen. And could I, as chair, on behalf of all of the committee and elected reps, thank yourselves for a very important and worthwhile engagement that covered so many different aspects, and even as you heard Councillor saying, as it went on, we got a lot more out of it in terms of such an important issue. And on behalf of the committee, I would just like to thank your four selves, Helen, Kate, and Tom. Thanking you.
Thanks, Chair. Could I just say once again, thank you to the committee. I was so disappointed not to be able to come to Derry and bring my colleague Ewan, as I've enjoyed many an hour in the city, and was hoping I would have had an opportunity to have a few pints of Guinness with Ewan, but we'll have to save that for another time.
Another day, Tom, hopefully. Hopefully. Far side of it, as they say. Thank you very much. Thank you. Okay. Thank you, folks. Thank you very much. Members, people would have says about in terms of his proposal, and his proposal has been in the chat box ahead of time. So I don't know if anybody wants to speak to it. Just let me know now. Okay, folks, is there anybody put their name down? I just can't see the.
Chair, yeah, you have Rory Farrell.
Okay, Councillor Farrell, Rory, please.
Thanks, Chair. SLP's happy to support this motion. Healthcare workers deserve a pay raise of over 3%, and there is speculation that 3% isn't even 3%. It's a 1.5% permanent pay raise and then a 1.5% one-off pay raise, which makes it all the more derisory and miserly. And when we compare this to the lavish extravagance of the test and trace system, which is going to cost somewhere in the region of £40 billion, and with consultants earning up to £20,000 per day to develop that system. And that's a system that a Westminster committee said made no measurable difference to managing the pandemic, but doctors, nurses, and NHS staff in general have made a measurable difference to managing the pandemic, and they deserve a pay raise, which is well above 3%. So SLP is happy to support the proposal. Happy to second, actually.
Folks, is it me that's off screen, or is it Councillor Farrell? I can't hear Councillor Farrell.
No, we have just lost you there, Chair. There are
Sorry, my
indicated
apologies.
speakers, Councillor.
Is Councillor Farrell finished? Sorry.
Yes.
Okay.
So Alderman Hussey and Councillor Boyle.
Boyle, Michaela. Okay. Alderman Hussey, Derek.
Thank you, Chair. I'm not a member of the committee and obviously won't have a vote on the proposal, which is unfortunate because I feel it's a proposal that should have gone to full council. That's what deserves to be heard. But the proposer has decided it should be a pop-up motion in committee, so be it. With regard to the wording, council condemns the Tory proposal to offer workers a paltry 3% increase. Totally agree, but did the Tory party not actually offer 1%? And it was agreed then that this would go to the pay review body. So it's actually the pay review body who have recommended this 3%, which is inadequate, as is rightly said here. And with regard to the issue going to the Stormont executive, I think we need to be aware of the Barnett consequentials. If the pay raise in mainland UK is 3%, that's what will come through to our health minister, will be a 3% increase in his budget as a Barnett consequential. So we need to have some way of mitigating against that drain, or diversion of funding from our health service, and to ensure that if the Stormont executive were minded to increase the 3%, which is quite right, is paltry. If they are minded to increase that, that we're sure that funding, is not going to come from elsewhere within the health service itself, which, as we just heard in the last presentation, is already under stress and in need of additional funding. Thank you, Chair.
Thank you, Derek. Councillor Boyle, Michaela.
Thank you, Chair, and Sinn Féin will be supporting the motion. Obviously, we've heard over the course of the last few days all the healthcare workers, particularly our nurses, who have been really frustrated and furious over this 3% increase. Obviously, the work that has been going on since COVID, prior to COVID, the pay increase for health service workers prior to COVID, I suppose, has always been an issue, a contentious one, but more so now than ever because of the extreme pressures that they are working under. We are listening to the Royal College of Nurses over the last few days on the media, who had said that the problem is that the nurses are going, they keep going, all the healthcare professionals, all the nurses, the whole team, they're working, and the last thing they want to do is industrial action. But obviously, it looks like, you know, that's the way it's going. And obviously the fear of that would be, you know, a backlog once again when we are just getting things off the ground and opening up for different things. So obviously the contribution from our nurses and healthcare workers during this pandemic has been phenomenal. You know, they've watched their own work colleagues under extreme pressure, some of them who even passed away from COVID. So to be hit now with this, it is indeed a slap in the face. But yes, we will be supporting this. Thank you, Chair.
Thanking you, Councillor Boyle, and I don't have any other speakers, but Councillor Harkin, they sum up.
I just see Morris Devaney is in the chat group there.
Sorry, I just
go before
my apologies. Go ahead, Alderman Devaney. Morris.
Thank you, Chair, for allowing me in to speak in this. And look, the DEP has no problem in supporting this proposal coming forward here. But like Alderman Hussey, I do have concerns that the 3% raise is paltry, it's derisory, and look, they need to be getting a better raise. But I do have the concerns that Alderman Hussey raised as well, that look, any raise that comes for our health staff when it comes across to the Assembly, that and he did mention the Barnett consequential and around that. And look, I do hope that when whatever this 3% raise, when it comes across, that it hasn't to come out of existing budgets. And we all know that existing budgets are under pressure, severe pressure, and the delivery of our healthcare service. So I just have that concern, but happy to support the proposal.
Thanking you, Morris. Councillor Harkin. Sean.
Thank you, Chair. And yeah, look, I appreciate everybody's comments on this. And just to Alderman Hussey, yeah, this should be a full discussion at the full council meeting, but that this happened this week, so I think it's good that we're responsive, and I will be happy if people want to discuss this more in a couple of weeks. But I think we have to. Our council has voted to support the health and social care workers and all the unions in their pay campaign. Which is a lot more than 3%. It's for their demands have been for a raise of between 10 and 15%, and 3 falls very, very short of that. So I think it's important for us as a council and this Health and Communities Committee to send out a message today that you know, we're not supporting this. We think it doesn't reflect the raise that health service workers and social care workers deserve, and that we're on their side. And Councillor Fowler's right. I mean, look, it's hard to make out exactly what the Tory cabinet were doing here. They were going to propose 1.5 plus 1.5 as a kind of one-off payment. Then they backed down and turned it into 3%. But I think it just speaks to the fact that they're not placing health service and social care workers really at the centre of their thinking. And I think if we think about the pandemic, I mean, the health service was very much at the centre of all our lives. And I think people understand why it is so crucial, needs to be protected. And that means protecting the workers that are at the heart of the health service. So, you know, yeah, I think it's miserly. I think it's squalid. I think it is a message of disrespect. And I think we should be loud as a council. And where should we get the money? Look, it's amazing that so much money exists in society in so few hands. I think we have to start thinking about how we can tax the billionaires to properly fund our health service, our public services, and make sure that there's decent pay and conditions for the vast majority of people. So thank you, folks, for your support.
Okay, Councillor Harkin. Sean.
Chair,
Folks,
just the record, because it's not recorded in the chat box, can I just confirm the seconder for the point of view of the minutes?
Okay. I seconded it, Karen, at the end of my sort of comments.
Councillor Farrell, Karen. So proposed and seconded folks, and I didn't hear anybody speaking against it. So unless anybody tells me anything different, I'm going to take it as agreement by all. Okay, thanking you. Members, I'm minded there's two councillors have items on chairperson's business, and I'm minded they take chairperson's business and then take a 10-minute break, if that's okay with the mood of the people. Okay, chairperson's business, Councillor Rachel Ferguson. Rachel.
Thank you, Chair. Before I go into my chairperson's business, could I just please pass on our condolences to the O'Donnell family. Noel O'Donnell was a huge presence for the Strathfly community, and the reason many young people have had services within the community, as well as the Tiny Tots community play group, sadly passed away. So just our condolences to the O'Donnell family and the pain that they're going through. Chair, I have a proposal. Many of you will know of the recent report where another woman was murdered in Northern Ireland, which is now we've seen 10 women killed in the last 16 months due to domestic violence towards women and girls. It's absolutely heartbreaking, and women are living in fear. We've all seen increased numbers of domestic violence cases due to lockdown, and these are just cases that are reported because we know far too well that many incidents go unreported. The Dolce Vita project, which I must declare I'm a member of their board and non-pecuniary interest, is a local charity who's helping support any victims of domestic violence, female or male, and they've seen a huge increase to the referrals. They're getting more referrals from the PSNI and self-referrals as well. They currently have 28 members of our community on their waiting list for assessment, and these referrals deal with a number of issues from providing safety, protection, legal and emotional support. They've also agreed a partnership research project with Ulster University and McGee, John McCord, which should begin in August. They've been applying for multiple bodies for support and more recently applied to Big Lottery, but unfortunately due to the limited knowledge of parental alienation in our health and service, they were not successful and now find themselves very close to closing their doors. I am fully aware the Council has limited resources and many charities are fighting for much deserved funding, which is why I'm asking for Council to work with La Dolce Vita project and write the relevant bodies to see if they can identify funding streams that will help them continue to do the great work they do for our city and district. Chair, I have reached out to some statutory bodies and some partnerships on my own capacity, but I just thought with the knowledge that we have with our council officers and our committee, if we could write to the Department of Health, Department of Communities, Department of Justice, as well as our partners to try and identify some funding streams to help La Dolce Vita stay open. So I've put that proposal in the chat box there, Chair.
Thanking you, Rachel. Thank you, Councillor Ferguson. Councillor Duffy, Sandra.
Yeah, thank you, Paul, for allowing me in, and thank you, Rachel, for bringing the proposal. I am aware of the great work that La Dolce Vita does. Their committee, including yourself, do sterling work in relation to domestic violence and the parental alienation role that they have taken. Unfortunately, we have seen COVID has affected them quite badly in terms of they had a planned conference, they had different things in the pipeline that has just affected their funding streams as well. So I am absolutely happy to second the proposal that has been made and would hope that there is some assistance that we can provide the Dolce Vita to ensure that they do continue and they are able to continue the fantastic work that they do with the many victims of domestic violence that they currently work with. So happy to second the proposal. Thank you.
Thanking you, Sandra. Councillor Riley, Martin.
Thanks, Chair, for bringing me in. And like others have just said in relation to this proposal, the Dolce Vita have been in touch with me as well in relation to this. I wasn't sure if it was coming forward as a proposal to today's committee or to full council at the end of the month. But regardless of that, happy to support the proposal on the floor. We all know from being on the likes of the PCSP, but in other work that we do as well, the increase of domestic violence during the pandemic, so certainly we should be trying to do what we can to support organisations such as this. So happy with the proposal, Chair. Thank you.
Thank you, Martin. Councillor Harkin, Sean.
Thank you, Chair, and thank you to Rachel for bringing forward the proposal. And we'll be happy to support it as well. We did talk to La Dolce Vita, and we're very aware of the work that they've been doing and the help that they've provided to people. And I think we have to do everything we can to address and help organisations that are helping women who face domestic abuse and others. So we'll be happy to support this too. Thank you.
Thank you, Sean. Alderman Devaney Morris.
You, Chair, for allowing me in, and can I just say to Rachel, and it's good to see this proposal coming forward here, and the DEP has no problem in supporting the proposal. I think it's become a very, very big issue, domestic violence increase since COVID hit us, and it's an issue that has been raised continually at our PCSP meetings, and Chair, we have no problem in supporting the proposal.
Thank you, Morris. Alderman Guy, Doran.
Chair, no problem. The Ulster Unionist Party supporting this proposal. It's definitely the 10 women sadly taken during lockdown as one's too many. Never mind 10, but happy to support this. But just could we maybe add the PCSP on that to see if there's any funding available for that from them as well? If Rachel wouldn't mind adding that in, just there, along with the different departments.
Councillor Ferguson. Rachel has indicated. Aye.
Happy enough for that.
Happy to.
Okay. Thank you, Chair. Thanks for that.
Okay, folks. Obviously, having nobody speaking against it, the proposal's there, and given what it is for, there seems to be a unanimous support. So I'm taking on that unless anybody says different. Okay, Councillor Ferguson, that's passed. The second councillor, in terms of to bring forward an issue, is Councillor Harkin, Sean.
Thank you, Chair. And again, this is an issue that couldn't have been raised other than today. I joined road service workers who are on strike today at the Woodburn Depot, just over there by the entrance to the Madeline shopping area. Not only Madeline, obviously, there's other shops there. And they're on strike against management bullying. And obviously, the weather was very, very hot today. And so it was not the most pleasant day to be standing on strike. But the workers are out, and it's a one-day strike. And the workers balloted for this strike, and they're members of Unite, and they agreed to the strike by over 90%. Now, they didn't do this on a whim. Talking to the workers, they said, look, this has been going on for many, many, many years, issues of bullying, and they have believed that they've had to take this action to try to get it addressed. And these are workers, again, who, I mean, there's a lot of pressure right now in road service workers. We all know about the many, many potholes and issues with gullies and everything else that we as a council, and I'm sure other councils across the north, have all been demanding be dealt with. Now, the pressure comes down on workers at the end of the day to get that stuff, to get all those issues fixed. So these are frontline workers who have worked right throughout the pandemic. And unfortunately, because of these issues, workplace bullying, intimidation and harassment issues, I mean, it is impacting people's mental health. It's impacted people's health and well-being. And that's why this is particularly pertinent for this committee. And unfortunately, look, we get calls as People Before Profit on a regular basis from workers who are facing similar things. in terms of their workplace, and they're not sure what to do. Most often, workers are reluctant to speak up about workplace harassment or bullying, especially if they don't have a trade union, and so they, they're reluctant because they know that if they raise it, then it could lead them to further problems for them down the line. So often people put up with this stuff, and it impacts their mental health, and it impacts, sometimes then it leads to people having to go off work on the sick, which is very, very, very unfortunate and not what workers want. So the demands of the workers, which I think we should support, are that they believe that there is potentially a culture of bullying in the DFA, in the Department for Infrastructure, and they are calling for Unite is calling for the DFA minister to meet with representatives of Unite to address these issues, and I think that that is something I think is very, very straightforward. They're basically asking for a meeting with the DFA minister to talk about this. I mean, they're very frustrated that it hasn't been addressed already by the minister, and that they've had to go on strike now to make their point. So, for all the reasons that I've laid out, related to workers' rights, related to mental health, related to health and well-being, which we've talked about a lot in this council, I think we should stand in solidarity with the workers and call on the minister to meet with representatives of Unite as soon as possible, because if they don't, workers are going to be going on strike again, and they're going to keep going on strike until they actually get this addressed, and that's going to then have a knock-on impact on our ability to see potholes, hedges, gullies, everything else actually dealt with, because that was a day today where those workers weren't able to go out and deal with them issues. Thank you, Chair.
Thanking you, Councillor Harkin. Thanking you, Sean. Alderman Guy, Darren.
Chair, we in the Ulster Unionist Party completely back this proposal and stand with the workers. There's no place for bullying anywhere, never mind in work. But can I add to your proposal? Can I make an amendment? Or an addition? And I can put it in the chat box if you want, Chair. But just to propose that DFI road service officials come to council to discuss alleged workplace bullying, as well as Unite representatives. I'll put it on the box here now, Chair. If you want me, go ahead.
Okay, Alderman Guy. Alderman Devaney, Morris.
Thank you, Chair, for allowing me in. And look, we have no problem in supporting the proposal that's going forward here. Bullying is unacceptable in any form, whether it's in the workplace or even in society. And I do believe that it's important that we urge the minister to meet with representatives to discuss the issue, and I do believe that Alderman Guy's addition to that probably DFI come on board as well to answer questions, but no problem supporting the proposal.
Thanking you, Morris. Alderman Hussey, Derek.
Thanks, Chair. Obviously, Group Leader has expressed our support for this. Just as a matter of interest, can Councillor Harkin outline, was it only at one depot that this strike action occurred? And is this bullying issue a localised issue, or are Unite suggesting that it's wider spread? No matter, even if it is just one location or if it's wider spread, it's to be condemned, whatever. Thank you, Chair.
Okay, thank you, Derek. I'm still awaiting Alderman Guy to to put into the box his amendment, but I just see it arriving there now. Thanks, Lauren. I'm going to take another councillor seeking to speak. Councillor Riley Martin.
Thanks, Chair, for bringing me in. Thanks to Councillor Harkin and then also Alderman Guy for the text that's on the screen or about to be put up on the screen. Just to, for the record, Mark H. Durkin, one of our MLAs, attended the strike this afternoon as well and spoke to the workers directly affected on strike there this afternoon. So happy to support the correspondence being sent off on behalf of Council. Thanks, Chair.
Okay, Councillor Duffy, Sandra.
Thank you, Paul. And just to add Sinn Féin support as well, I know that the workers have been in touch with some of our elected reps as well. So happy to support the initial proposal and the amended one going forward.
Okay, thanking you. I have no other speakers, folks, and obviously we had a motion, and now we have Alderman Guy's amendment. Councillor Harkin, are you accepting the amendment? Sorry, go ahead, Councillor Harkin. Sean.
Thanks, Chair. Definitely accepting the amendment. I think it's adds to it, and I should have thought of that myself. But thank you, Alderman Guy. I was trying to make it as short as possible, but that is. I think the workers will appreciate that. I think that Unite will appreciate that, and I think that that's about having direct accountability. So, good, great amendment. And just to Alderman Hussey's question, I think what the Unite is saying is that they are raising the concern that there is a culture of bullying, and it was mentioned to me, at least by workers and Unite representatives, that there's other places where this may be a problem, but they haven't chose to strike yet. I think that this is built up at this particular workplace, where, believe me, this is the last thing the workers there wanted to be doing today. And obviously workers usually go on strike for better pay, improving pay terms and conditions. So it's really been a last resort for them to go on strike against bullying. There is a Unite statement that's been circulated to the press, and I'd be happy to share it in the chat. But that's basically, what I have been able to learn.
Okay, Sean, thanking you. So, folks, if we take, and from what I'm hearing from obviously all of the elected representatives, there seems to be unanimity on this. So, if we take the amendment first and take in that everybody supports the amendment, unless anybody says any different, the amendment's passed and becomes a substantive motion. And once again, without being presumptuous, but if from what I'm hearing, if the motion has unanimous support and passes, unless anybody tells me anything different. Okay, thanking you, folks. Thanks to people who brought forward the motion and the amendment. And folks, if I could suggest that we add up 5 minutes onto that 10 minutes and come back at 6:30. That's okay for me. Okay, members and officers, are we all ready to go, as they say? If we are, item number 7, which is matters arising from the open minutes of the Health and Community Committee held on Thursday the 17th of June. And for accuracy, please, pages 27 to 40, 40 to 60, 60 to 80, accuracy. Proposer and seconder, please.
Co-proposed, Chair Morris.
Okay, Morris, thank
Seconded, Chair Darren.
Darren, thank you. Alderman Guy, thank you, Darren. Matters arising, pages 27 to 40. Pages 40 to 60. Matters arising, pages 60 to 80. Okay, members, moving on to item 8, and if I could ask Seamus, please, to pick this one. All right. Seamus? Just 2 seconds, folks, just.
Chair, he'll be with us in just 2 seconds.
Okay.
Yeah.
Darn.
Thanks, Chair. This report relates to a consultation document published by the Home Office on a Protect Duty aimed at making the public safer at a wide range of public venues. The report outlines the public venues and organisations which the Protect Duty may apply and the proposed criteria such as venue capacity. It is proposed that organisations consider threats to the public, assess risks and consider reasonable security and organisational preparedness measures. 2 council functions which may touch on this area include the PCSP and the Safety Advisory Groups for large events. And Chair, a draft consultation response has been prepared for members' consideration and approval.
Okay, thank you, Seamus. Any members wishing to comment? Councillor Doyle, Emmett.
Thank you, Chair, for allowing me on. I think one of the biggest considerations that I had when reading this was, is it going to affect, for example, the public liability insurance that a lot of our businesses have? If they haven't carried out, seems to be a fairly wide-ranging risk assessment, which for this part of the world, could include a whole rack of things. Is it going to affect businesses' opportunities to continue to be insured properly? So I think that should be one of the considerations that's maybe outlined in our consultation response, because obviously people in smaller businesses coming out of COVID, that's one of the massive costs that they have to incur. So I think it'll be really key for us to get some clarity on that as well and include in the consultation response. Thank you, Chair.
Thank you, Emmett. If nobody else as it stands, folks, and obviously, Seamus, the point that Councillor Doyle makes, can that be?
Yeah, yes, Chair, I'll make those amendments and submit to the department or to the Home Office.
Okay. Alderman Devaney has so proposed. There's a seconder.
I'll second that, Chair.
Okay, Alderman Guy. Okay, folks, people happy to move on. Thank you, Seamus. Item 9, Barry, please, in terms of community centre venue fund.
Thanks, Chair. Members, the purpose of the report is to seek your approval for the recommendations of the Community Centre Venue Grant Aid Assessment Panel. Members, you'll be aware that this was introduced as a part of a new grant aid programme in 2017-18 financial year, provided grant aid to 20 community centres for a 3-year period, and that Council extended that to March 2021. The fund provides support to constituted not-for-profit organisations. You can get up to £12,000 per annum for Tier 1 and up to 7,500 per Tier 2, and the overall budget within rates members is £195,000. Tier 1 of the community centre fund primarily targets community centres within the top 30% most deprived areas in relation to proximity to services, and Tier 2 funding primarily targets community centres within the top 10 most deprived in relation to multiple deprivation. And you'll be aware, members, that the Tier 1, the top 30 and the Tier 1 is more applicable really to our rural centres that don't receive neighbourhood renewal funding. So members, you'll see in your appendices, due to the amount of funding available, only 19 applicants will receive the full funding, with 2 applications being partly funded due to budgetary constraints. Should further funding become available, these 2 applications, along with the 9 other applications that were deemed successful, having scored above the threshold, will be placed on a reserve list and allocated accordingly, members. So we've yet to receive our allocations from DFC or from our VCU grant, but we're expecting that anytime soon, members. So in terms of the recommendation, that members approve the decisions of the assessment panel for the Community Centre Venue Fund as listed in your appendices. Thanks, Chair.
Thanking you, Barry. First, Councillor Farrell, Rory.
Thanks, Chair, and thanks, Barry. Obviously, it's good news for the 21 organisations that were either funded or partially funded, and it's disappointing for the 9 others that met the scoring thresholds but didn't avail of funding because it's currently exhausted. I think it's important that we have that reserve list if any monies do become available through in-year savings or whatever. But Barry, briefly touched on the funding contract from DFC. Have we any indication of when we'll get that and that the money will be confirmed? Thank you. But happy to propose the item.
Thanking you.
Through yourself, Chair. Yeah, that we expect that in the next number of weeks. Chair, it could have arrived in the last couple of days and been someone's desk, but we will follow that up. It's not unusual for these letters of offer, both within our Good Relations Fund or our VCU Community Support Fund, that they don't always arrive in April, May, or even June. So I'll follow up on that, but it's not something we're unduly worried about. It's a common occurrence, really, and the year that's in it as well, in terms of the COVID grant money and all coming out. So look, we'll follow that up as a team, but we expect that pretty soon, Chair.
Thanking you, Barry. Alderman Devaney, Morris.
Thank you, Chair, for allowing me in. And like the previous speaker, I congratulate those 21 who have good news that they are going to receive funding, and some of it part funding. I do worry, Chair, and around the 9 others, because these are vitally important venues to us. Look, a rural council, when I just mentioned rural council, but there's venues in urban areas as well that are under pressure. And when we look at quite a number of these venues, we have been applauding them on the back this last 6 months or a year for the great delivery and service that they have given to council through the COVID pandemic, and I think we could all agree on that. I do understand about putting them on the reserve list. I do have an issue with that. Look, it may never happen, but Chair, I would be happy to put a proposal that that officers go away and review funding sources for those groups that met the criteria but weren't funded. And I would also, and this is not part of the proposal, I would also ask that officers, for those who didn't meet the criteria, that our officers go and meet with them and discuss their viability and sustainability and give them affordable any help that they can. But I do think, Chair, that we need to look at least those that met the criteria, and should that funding be through savings or what it might be. So I would make that a proposal. And do you want me to put it on the chat box, Chair?
If you
Or
would,
is it straightforward?
we would. Sorry?
I'm a wee bit slow at typing, but maybe Karen, maybe would. Do you want me to put it in the chat box?
Okay, thank you.
Chair, I'm content to second Alderman Devaney's proposal. Thank you.
Okay, Councillor or Alderman Kerrigan. Alderman Guy, Darren.
Thank you, Chair. I'd just like to agree with the previous two speakers. It's obviously in the rural, mainly in the rural areas, and obviously this would have a serious impact and put certain community centres into an uncertain and potentially unsustainable position. I know we don't like for groups to basically put all their eggs in one basket, but obviously in the rural areas they don't seem to get as much funding as urban areas. And what Alderman Devaney said there, and the fact that those that have met the threshold who haven't been paid out, how often do we know how often that, especially with council funding, that these groups actually receive funding and they end up, or how often that they basically there's no funding that's been able to be found and they just have to take it on the chin. But look, I noticed recently there's a massive difference in scoring and percentage scoring from those that are topping the threshold and the scoring charts to those that are basically falling short, well short. And I know that the council and the officers and themselves will basically work with these groups to try and improve them and trying to help them on with applications and things like that. But there is a massive difference eminent now, and even those that are meeting the threshold and not being paid out, is there a case to change the process in which money is divided up? I know there it's 12,500, but it's, could we possibly look at certain tiers within those that have met the full threshold? Is that maybe a way forward for this? Or what options are available? So that's everything. Thank you, Chair.
Thank you, Alderman Guy. Councillor Boyle, Michaela.
Yeah, thank you, Chair. And I suppose I just want to, welcome the funding for the groups that were successful. Many of them were in a rural area, and I suppose just sitting on the, like Alderman Devaney sits on the rural growth partnership, the Sperrin one. We do know I suppose the anomalies there in terms of access to funding and how hard it is for the groups in the rural areas to access funding. But I suppose I can just say I'm delighted that some of the rural groups, particularly the Learmont and Glenelly and Ahibrack and Ahiarn and Churchtown, that have received funding. It is disappointing to those who did apply and weren't successful, and I take on board the comments made previously. I know the allocation subject for receiving a contract for funding from DFC, and hopefully that will allow the funding to be distributed in a fair manner. I'm also looking at the community centre, the tier 2, and a lot of them are, every group is deserving of funding. Any group that applies for funding through council is deserving of funding, but obviously there is a process, and you'll have winners and losers in every aspect of how we approach funding and how we process that. So I just want to say for the here and now, it is good to see a lot of the rural groups been successful in this regard and the tier 1. Because it's not always the case, you know. But that said, I do appreciate the fact that there are many urban groups and community centres who do and need a lot of funding, particularly coming out of the pandemic, where they used up their own resources in terms of helping and supporting the community. The rural area done the same, but just to say that, you know, there's a good deal of work goes on behind the scenes in this regard, and just to thank the officers involved in that, to Karen and her team. It's not easy when there's only a small pot of funding and so many baying for it, and it's difficult, but hopefully those who weren't successful this time round will certainly be successful in round 2. Thank you, Chair.
Thank you, Michaela. Alderman Hussey, Derek.
Thank you for allowing me in, Chair. Can I endorse comments that have gone before? Firstly, sincere congratulations to those who have been successful, but the concern remains on those who have met the threshold but have not been successful in funding. And I have a sincere fear that this could be the death knell for some of those locations, and it needs to be addressed. And I do welcome Alderman Devaney's proposal that we need to go and look at this. The one thing that we cannot afford to do is to lose these community hubs and you know, very active and vibrant community hubs, and as has been said during COVID, lifelines for many within the particular communities that they're located in. One quick question to, I think it was Barry who presented this one. The funding applied for £12,000. It actually states up to £12,000. And I wonder, you know, given that we have percentage scoring, was there a look at you know, the percentage that's actually awarded, and you know, would that, you know, if it had been awarded on a percentage score basis up to the 12,000, would that have enabled funding to be distributed further down the line to others who met the threshold? Thank you, Chair.
Thank you, Derek, and invite Alderman Kerrigan. Keith.
You, Chair, for allowing me in. And Chair, just as I had seconded Alderman Devaney's proposal, to be fair, Alderman Hussey there has kind of took the wind out of my sails there. I was going to comment on those lines as well. Was there a potential of seeing would there been a way of splitting up? Instead of giving the full 12 to each of them, could we have potentially given slightly less, but then provided money towards more groups? And again, the point that for some of these groups there, without this funding and given the work that they have put in over the pandemic period, it could be that could be the final nail in the coffin that could maybe kind of close some of the doors there. So as I say, it's just, as I say, that's the reason why we're supportive of this, of the proposal brought forward for Alderman Devaney. But thank you, Chair.
Thank you, Keith. Councillor Duffy, Sandra, please.
Thank you, Paul, for allowing me in there. I really do. I get the sentiments of where people are coming from in relation to this, but I would just urge a wee bit of caution in relation to unravelling a process that has already run, that applications have come in, they have been fairly assessed and fairly scored, and this is the lie of the land. We had the same issue last month when it came to good relations funding, and where that was, and I had similar issues with my own community, where really good organisations that are providing excellent programmes within the community lost out on programme costs there as well. So we need to be really careful at this stage. We have a pot of money that is to be distributed. We have to find a fair way of distributing it, and this is what we have come up with in terms of grant aid. Every year we have the same issue here, where it's nearly we try and unravel the process because X group or Y group didn't get funding, and I really feel for every single group that hasn't been funded, but our council officers are there to work with them, to assist them in finding alternative sources of funding, as well as being on the reserve for the council funding, and they will also work with the groups who haven't met the criteria in relation to their capacity and how they can then put in adequate applications maybe the following year that will score adequately to come higher up the list and to receive funding. So having said all that, I would suggest a small amendment to Alderman Devaney's proposal there, if that would be acceptable, just to keep us on the right track, because I would be really concerned that we have applications here where people have worked really hard on them and they have scored the adequate points, they have been awarded the funding, and we now try and unravel the whole process. So my amendment is that we remove go away and review funding sources to that officers work with those groups. So if we could strike out go away and review funding for, strike that out. Sorry, Noah.
Sorry, folks. Do you see when we're sort of waiting on that there, and I don't have any further speakers, and I normally wouldn't come on as chair, but in terms of, I think it's last month's committee or the month before it, there was other processes ran in terms of good relations, community centre support, and there was groups, or the outcomes would have been something similar to this, where you would have the groups reaching the threshold, but there's not enough funding in the pot. And so I just would have a big concern that we're not just unraveling this process, but we're going down the road of unraveling a number of other processes, and who decides which set of groups that must out and in what order. And I just feel that we're on very dangerous ground here, for what it's worth. And I don't even know in terms of the proposer and seconder, as they give a bit more time for consideration and also input from officers as they defer to full council. Other than that, I would have to say, out of major concerns, that we're entering into a very dangerous road. Thanks for that, Paul. Okay, Councillor Duffy.
Yeah, I just put a suggestion there in the chat box, just to speed it up a bit.
Okay, Councillor Duffy's put on an amendment. Any further speakers on the amendment?
Chair, in light of the, no, let Derek speak first.
Okay, Alderman Hussey, Derek.
Thanks for letting me in. As you know, I'm not a member of the committee. I'll not be voting on this. And I appreciate where Sandra and indeed yourself are coming from. There's no questioning the scoring and the assessments, that have been given. My concern is with the allocation. Whenever we talk, we regularly talk about funding is available up to, that's a target. It's not a set figure. And therefore there should be some reflection of the scoring that groups have achieved. If you look at that, a group that scores 68% gets the full grant, two groups that score 67, 1% below, go down to 60% of the full grant. I know there has to be a cutoff point, but I think that the allocation should also reflect the scoring. That's my own personal opinion. Thank you for that, Chair.
Thank you, Derek.
Chair, in light of your own comments, I would be happy to defer this to full council. I would be happy to withdraw the proposal and defer it to full council.
Okay, I'm just
Chair,
Is that appropriate?
I have tabled an amendment which has to be taken anyway, so.
Councillor, if you want your amendment taken now?
Yeah, I think we have debated it. I think that we could take it now. I mean, it is it is ensuring that the process that has already been run is protected, but it's also asking council officers to work with the groups that haven't been successful to assist them in finding alternative sources, and that's what we've been discussing for the last half hour. So I'm happy enough for the amendment to be taken now.
Okay, Alderman Guy.
Thanks, Chair. Basically, listen, I don't think anyone's looking for that to be changed in the middle of this current process with the community centre venue one, but I think that there is scope there to maybe look in the future for possible alterations to the way that the process has worked out. Now, saying if the officers went away and came back with something that mightn't work any better, we might just say, no, you know what, better the devil you know. But maybe there is scope there just to look at a few changes just to see what could happen for the future. Not now, not in this process, but in the future. Thanks, Chair.
Okay, folks, I have no further speakers and have an amendment which a number of people have said they were happy to support. Is there anybody that doesn't support the amendment?
Chair, in light of the ongoing discussions, let's look at the amendment as long as that these groups are contacted with and they're given all the help they can. But I would have believed in my heart that I understand the frustration of some and around unravelling the process. But I think Alderman Hussey has made a good comment. But Chair, I'm happy to go with the amendment as long as we have the discussion with those groups, because I can tell you, Chair, I can assure you I will be back with some of these that the doors will be closing. Thanks, Chair.
Okay, appreciate that, Morris. Alderman Gay, were you looking on again?
Chair, look, I'm happy to go with the amendment just to move this forward, but it's basically just what happens anyway as the amendment. So happy to see it through. Okay, Chair.
Okay, folks, we seem to have unanimity on the amendment, unless somebody tells me different. And on that basis, we will move on. Thanking you. Thanking you, Barry. Item 10, Barry again, please.
Thanks, Chair. Members, the purpose of this report is to seek approval for gating orders for Cairn Hill and Gallia Park. Members will be aware that we've previously approved a number of gating orders and we've listed those in section 2.3. Both these proposed locations, the Department for Infrastructure has advised that there's no objections to the erection of the gates as long as the gates are opened at 8 AM each morning to provide access to utility services. You'll see in section 3, members, in terms of the community safety team have assisted residents carrying out surveys. We've attached surveys for the Cairn Hill proposal in Appendix 2 with householders from 224 to 259 Cairn Hill. A number of residents from both areas indicate their willingness to act as key holders if the gates are installed. And some of our members will be aware that there's been numerous reports in the media of incidents recently of antisocial behaviour in this vicinity, and there's been quite a bit of work ongoing with the community safety wardens. So members, in terms of the finance, the cost of the manufacture and installation of the gates will be covered by other partners, and the Housing Executive has indicated will consider funding the Cairn Hill proposal. However, Council will be required to meet the cost of the public advertisements, which the PCSP has agreed to meet, and any future maintenance of the gates, including public liability. Council's legal section will drop the gating order. The proposal links into the Ballyarn local growth plan. So in terms of the recommendation, members, that you approve the gating orders for Cairn Hill and Gallia Park to enable gates to be installed at locations detailed in the maps in your appendices. Thanks, Chair.
Thanking you, Barry. And I have 3 speakers so far, starting with Councillor Farrell. Rory.
Thanks, Chair, and thanks, Barry. Brilliant news for the residents in Gallia Park and Cairn Hill who have been plagued by antisocial behaviour in recent years. Hope these gates are going to make a noticeable difference to this anti-community activity, and that the people living in the vicinity can lead a sort of peaceful, calm and nuisance-free life when the gates are erected. It's a brilliant example of partnership working in Ballyarn through the community safety team, and I'd like to thank PCSP and the Housing Executive for their input. So it's brilliant news for residents. And I was involved in the survey work, so I know how important it is to the residents, and I just hope that the gating orders, whenever they are advertised, that there's no objections. And that we can proceed with installing those gates. But Barry, if you could just, one question, what are the next steps here? So the gating orders are advertised in the local media and the Belfast Gazette. Have we any sort of timescales if there are no objections for the gates being installed? Thank you. Happy to propose as well. Thank you.
Thanks, Chair. I'm not sure of the exact timescale, Councillor Farr, but yeah, once we receive committee and then council approval, the PCSP will progress with us as quickly as possible. Advertising in the press as advised, you have mentioned there, it's also in the report, and we'll try and progress this within a matter of months.
Cheers, Barry. Thank you.
Can't hear you, Chair.
Councillor Duffy, Sandra.
Thank you, Chair, for allowing me in. And Councillor Farrell outlined it there. He talked about partnership working. Myself and Rory actually were out in site meetings together in relation to it. So true partnership working there, Rory. But no, happy to second the proposal. It's something that we have been meeting with residents in both Cairn Hill and Gallia Park over many years in relation to the anti-community issues that they have been facing, and it will be great news for them today to get this passed. I know the importance it is for them. I know the issues that they have been facing, and the community safety team in the area have worked really hard in terms of getting this to where it is now, with surveys and all the rest of it. So well done to them, and just a sigh of relief probably for local residents that this hurdle will be passed, and then we can get it to the next bit. But happy to second the proposal. Thank you.
Thank you, Sandra. Councillor Doyle, Emmett.
Thank you, Chair, and I suppose just to echo the comments from my DEA colleagues, I know this has been coming a while, and I've had a number of calls, as I'm sure we all have, about the anti-community behaviour down around Gallia Park in particular. So I know that the residents will be buzzing whenever this comes to fruition, and credit as well has to be given to the community safety team and all the partners involved for bringing it to this point. Thank you, Chair.
Thank you, Emmett. Councillor Harkin, Sean.
Thanks, Chair. Yeah, look, I'm glad that this is that the residents are going to get some relief with these gates going up. But you know, I don't really share the enthusiasm that the SDLP and Sinn Féin seem to have. I mean, look, this is antisocial behaviour, because these are the very areas that haven't had the amenities, haven't had the kind of hope that you know, can challenge some of the reasons for antisocial behaviour that are very high on deprivation lists. And I'm sorry, but like, look, gates and more gates isn't going to solve the problem. So like, it's actually disappointing that this ends up being the solution, and we have to work towards actually seeing, you know, there being no gates, and that's the things we've been talking about here in the council, about how do we address poverty, how do we address the legacy of deprivation, you know, that create conditions for antisocial behaviour. So as I say, you know, I'm glad that the residents are going to get some relief and get some control, but I don't think that this is something we should be celebrating. This is hardly something we can claim as a you know, progress for the council. Thank you.
Thank you, Sean. I know Councillor Farrell, Rory proposed it. Sandra, did you second it? My apologies if I missed it.
Yes, I did, Paul. Thanks.
Okay, okay. Folks, I have no other speakers, and I don't hear anybody speaking against it in the sense of being against it going ahead. So unless anybody tells me any different, when you take it as being unanimous that it goes through, and ask Barry and thank Barry for that, and ask them to deal with number 11, please.
Thanks, Chair. Members, the purpose of this report is to seek your consideration and comments on funding to be provided from the Department for Communities in relation to further COVID recovery funding and social supermarkets. Members will be aware of the range of COVID-led response initiatives delivered since the beginning of the pandemic. A total of 1.6 million has been allocated to date for a range of programmes. As members are aware, the Minister announced on the 24th of May the availability of further funding in response to COVID, and this includes 3 million for the council-led community development and advice. The Minister's office has confirmed this funding should continue to directly support grassroots organisations' response to the pandemic and be reported on separately by councils as specific COVID support. The type of activity may shift to rebuilding and recovery work, but must still be focused on community-led COVID interventions and not general community development renewal work. The department has also been consulting members with councils with regards to further funding for access to food, and this funding includes 1 million welfare response support secured to support social supermarkets and 1 million for the emergency response to COVID-19. In addition to this, council has also received £165,792 as transition funding in relation to access to food, and a total amount of 36,687 has already been allocated to allow groups to exit from the Access to Food programme, leaving a balance of £129,105 to allocate during this financial year. It's anticipated, members that are present, that the above initiatives will be required to be delivered by the 31st of March 2022, and the timescales for the allocation of funding following a letter of offer from the department, coupled with the year-end spend requirements, will be very challenging for the team. With regards to the social supermarkets across Northern Ireland, DFC have indicated their intention to work with councils. They've indicated they will hold separate discussions with councils where pilot social supermarkets already exist in terms of future delivery mechanisms, including the role of councils. The pilot social supermarket programme commenced in October 2017 as part of the welfare reform mitigations, and at present, Derry City and St Bandis Council has 2 pilot social supermarkets, including Apex Social Supermarket and Strabane Community Project. There are further 5 pilot sites across Northern Ireland. The department has indicated the intention to consult with Solus in relation to future co-design and delivery of social supermarkets within councils. The resource requirements within council in order to deliver on this additional COVID-19 response will be considerable, and I know the directors presented a full report for your information, members. Coupled with the existing monitoring and evaluation of previous programmes and the resources required in relation to various audits of community development funded programmes over the coming months, There will be a need to consider the resource requirements in terms of delivery. If this additional funding is to be delivered like the previous funding through the community development team, it will simply not be possible to deliver a range of the other services that the team normally do and carry out pre-COVID pandemic. Members, I'll refer you back to section 3.2 as well, and I'm happy to answer questions on it, but with regards to the social supermarkets, there is a fear from officers that there could be a liability with councils, left with councils, if we are asked to undertake a 1-year pilot and the money comes in through councils and then the funding is cut. That would leave that liability that councils would have to fund the social supermarkets going forward. So you'll see in the section 4 around finance that the department has not indicated just yet the level of resource to each council or the formula which will be utilised, but we're expecting somewhere in the region of $750,000 additional funding. And as I've highlighted previously, additional staff resources will be required to deliver this. So in terms of the recommendation, that members consider and comment on the DFC funding and the associated issues outlined in this report. Thanks, Chair.
Thank you, Barry. Councillor Burke, Tina.
Thanks, Chair. I suppose it's just I just like to obviously propose and welcome the report. Barry has lined a few issues there as well, but I think what the COVID and the pandemic obviously magnified, but not only magnified, but added to we already knew was a very serious situation that our city and district faces in relation to poverty. Just last week at the Anti-Poverty Task and Finish Group, we actually received a presentation which highlighted various indicators across the board, the extent of poverty and deprivation that exists within this city and district. Despite in this role as council, we us all being well aware of the issues and the situation our communities are in, and having dealt with the issues individually, I think for me anyway, when it was all presented together, the figures and statistics were still startling, despite knowing them previous anyway. In my own role in the community, we have looked actually at the social supermarket model, and during that discussion of the Anti-Poverty Task and Finish Group last week, we have discussed it and how it could be used to address some of the challenges that the community face. Obviously, it's not going to be the be all and end all addressing, because poverty is such a widespread issue, and it's going to take a lot more. But I think this is sort of something that we could be used as a pilot to see if it can. I actually had an opportunity to visit a group in Strabane, the grassroots group, who use the social supermarket model and seeing the work that they're doing by applying that more holistic approach and trying to tackle some of the roots of the issue and empower the people themselves and the communities to make more meaningful changes in their lives. And I have to say, some of the discussion that I had up there with them, though the results they were positive. So welcome the announcement of the pilot, and happy to propose the report. Thanks.
Thank you, Tina. Councillor Farrell, Rory.
Thanks, Chair, and thanks, Barry. I've just got a couple of questions. Obviously, this rumoured £750,000 is good news. I'd like to get an understanding from Barry about what type of interventions do you think would be allowable, and have you got a plan in terms of how to allocate it? Is it going to be like the last tranche of funding where it was basically DEA focused with some money going to the food bank, etc.? And at item 2.3, it says there's still 129,000 outstanding for the Access to Food programme. Have we got proposals for that? And probably the main concern that we would have is about the pressure on the community development team. You know, they do a fantastic job. The workload has increased immeasurably since COVID, with the extra work that's come down in terms of allocating all this money from DFC, etc. So in terms of the extra resource required, what are you asking for here? Is it more staff? Is it overtime? And I'm just aware, or I'm mindful, that the amendment to item 9 has put more pressure on the community development team that they weren't anticipating. So I would like to just get officers' view on those points. Thank you.
Thank you, Rory.
Thanks, Chair. Councillor Farrell, I'll answer the couple of questions, the easy ones first, in terms of the $750,000. We haven't got the detail as yet from the department exactly what they would like spend the money spent on, but they are edging more towards recovery rather than, you know, the programs that we had within the pandemic, a bit like the tail end of last summer when there were recovery plans in place. So it's something along those lines, and anything obviously that is proposed, and when the letter of offer comes in, we will bring further detailed reports back in for members' approval. With regards to the access to food, that 129,000 you've referred to, that was, there was previous reports on that. What the report's stating there, there's been 36,000 allocated, and then the remainder has to be spent over the course of this year. We will again be bringing further details in as and when those initiatives come forward. So those are your first two questions. With regards to the staff resource, not quite sure yet. We're just highlighting to members in that whenever the pandemic first hit, the community development team went into COVID response pretty much from the pandemic till the end of last summer. And as we came out of the first phase of the pandemic, we started to do a bit of recovery and normal service delivery around good relations, around grant aid, DA engagement, all of the things that the community development team do. But as further COVID monies, further advice monies have come down the track from the department, we're finding that the community development and the good relations team are spending 90% of their time doing that, because there's huge monitoring and audit requirements from the department around all of that. And now we're still spending monies, we're still kind of like monitoring, and then there's further monies coming down the track. So the team are probably at their maximum at the minute, and that's where we're highlighting to members that there will be implications in service delivery. And I think you referenced the last paper where we talked about the venue fund, and at present we probably wouldn't have the staff to go out and meet all of those groups simply because they're swamped with the COVID stuff. But look, we do that. We do various things with the groups via Webex, and we do meet them and send on suggestions, and there still is engagement at that level. But the fear is if the further monies come down the track in the next number of weeks, that the team will be fully allocated to deliver that between now and the Christmas period. So we haven't scoped out exactly what the requirements are, but we're in the process of doing that. And we're just highlighting to members that the community development team are not working in normal circumstances and not providing normal community development delivery as they would have in previous years. Thanks, Chair.
Okay.
Thank you, Barry.
Right. Okay, Rory, thank you. Councillor Harkin, Sean.
Thanks, Chair. Yeah, look, I think that our challenges here in terms of poverty and deprivation are well established. But I think you know, going through the stats is we can't say it and repeat it too many times, because it should be the alarm bells that we're hearing every day. But we do have the highest poverty rates in the north. We have the highest economic inactivity rate. We have now the highest number of youth unemployment, unfortunately. So the level of need here, I think we all know, is very high. And if Boris Johnson and his cabinet plan of, are forced to do a U-turn on their plans to slash the £20 universal credit increase that people have had, that will push more people, unfortunately, into deprivation in the winter, and put them into deeper hardship, unfortunately. And inflation is rising. Everybody knows gas bills, electricity bills are all going up, and that means that people are going to be challenged to pay for basics, and that's a lot of people in our district. So we welcome any funding that comes through to actually try and address food need, fuel need, and everything else that should be getting funded. I would just say, look, we hope that as many of the lessons that we've learned throughout the year and a half of the pandemic are learned, and that as much of the money reaches the people that need it, that it's done in a way that doesn't exclude anybody, that includes as many people as possible, and that it goes to organisations that can really best carry out, the tasks of reaching people. So, we welcome the news that there's some funding. I would say, there's never enough funding that comes in, because given our challenges, so I hope that there is $750,000 coming in addition to the funding that's mentioned there, and hopefully there'll be more.
Thank you, Sean. Alderman Devaney, Morris.
Thank you, Chair, for allowing me in, and from our party, we have no problem in supporting the recommendation, and appreciate the comments of the previous speaker that look, when we get money, lessons have to be learned from the last time, and that we make sure that any money is allocated, it goes to those people who really need it. But thanks, Chair.
Thank you, Morris, and I don't see any other speakers in relation to this. I know Councillor Burke proposed it. Do we have a seconder?
I'll second, Councillor Farrell.
Councillor Farrell, thank you, Rory. And I don't seem to hear any people speaking against the report or the recommendations. So unless I'm mistaken, if we can move on in the business that it has unanimous support. Okay, appreciate that, folks. And if I could ask Karen in terms of item 12.
Thank you, Chair. And members, we're taking the opportunity this evening to advise you of the consultation process that DAERA have just launched with a closing date of 6th of September. In normal circumstance, this would have gone to the GSP committee meeting, as it is a cross-cutting consultation involving all directorates. And for that reason, the Director of Legacy will be undertaking a process during the summer recess to engage with you further to prepare a paper. You'll be aware of the background of the delivery of the Rural Development Programme, the EU-funded strand of the Department's activity, and the cessation of that specific programme. That's provided the Department with an opportunity to look at a new framework for Northern Ireland, and they've been consulting for some time to actually identify what the strategic drivers will be for the Rural Development Programme going forward. She'll note in the paper that looks at the impact of COVID in rural communities, green growth, including the need for access to nature whilst ensuring sustainability, opportunities for new ways of working and funding post Priority 6 under the EU Rural Development Programme, the priorities set out in the draft programme for government, and those set out within the New Decade New Approach Fund. So I suppose the key objective is around ensuring that there is a sustainable rural community where people want to live, work and be active, and a series of thematic pillars are proposed. You'll note that in the report there is a consultation link, which leads you to a number of other documents, which should be referenced in terms of framing your contributions to this, this consultation response. So members, just asking for you to note that, to be aware that the Director of Legacy will engage with you, and under delegated authority, the Chief Executive will submit that response. We can circulate it to you as members in draft if you wish prior to that. Thank you.
Thank you, Karen. And in terms of any members looking to comment at this stage?
I would propose that it's noted, Chair.
Okay, thanking you for that, Morris. Councillor Edwards, Stephen.
Yep, happy to second there, Chair, and look forward to getting the first draft through anyway. Thanks, Chair.
Okay, thank you, Stephen. Okay, members. Ask Karen again to take item 13, please.
Chair, members, this report is to advise that we may require additional resources for the community development section. I think we've debated that as part of a previous presentation to allow us to provide the necessary support and input to the wider audit reviews that members have agreed to undertake. In many ways, it mirrors I suppose, reflection of the resources needed within the audit team. So we're seeking your approval this evening to I suppose, access those resources as required within the department to support that audit process.
Okay, thanking you, Karen. Any member wishing to? Councillor Farrell, Rory?
I'm going to speak again, but my questions and my comments are going to be pretty similar to the last item I spoke on. So we obviously fully support the audits detailed in the report, and we fully understand the existing pressures in the community development team. And we appreciate that those are only going to increase with the COVID recovery monies that are coming down the track. But I think the recommendation, it's pretty vague, I would say. Do we have any understanding of the actual additional resources required? Are we talking about hiring new staff? Are we on about moving staff from other roles within the council? Are we on about people doing overtime at weekends? That's what we need to bottom out here, because I'm not sure, it's just asking for additional resource. It doesn't say what the resource is, how much it's going to cost, and does this additional resource need some sort of expertise in audit, and if it is a hiring process, how long that's going to take. I'd like a bit of detail on this if possible. Thank you.
Thank you.
Okay, members, in terms of the quantum of the resource, we're relying on the terms of reference that has been agreed developed and presented to you in September by the audit team to be put in place. We need that to, I suppose, evaluate the extent of the resource. In terms of the nature of that, as you know, our policy is to look at internal resourcing initially. That may mean, potentially resources from other areas within the council that are perhaps not fully utilised in terms of specific project management, or where a project perhaps has come to an end. So that will be our first source. We can sometimes acquire those resources on an interim basis. So again, it'll depend on the projected duration of the piece of audit work. So we'll take that into account. So I suppose management make a recommendation, and that'll become clear, I suppose, in the audit report that comes to you in September as to the extent and cost of those resources. So it's probably just early days until the terms of reference is complete, Councillor, to be able to give you a full response.
Can I just come back on briefly? So we're not actually approving additional resource today. There's going to be a further paper that's going to quantify that. Is that right?
Yeah, we can only quantify it when the terms of reference is complete and signed off by yourselves as councillors. So there will be a reflection at that stage of what that additional level of staffing implement is. And I suppose because you've heard of the demands in terms of the additional funding, these two processes are running in parallel. So we need to account, for what the relationship is and the demands on the individual officers we have at that particular point, when it's clear exactly what the process will be.
Is that okay, Rory, or is it?
I think so.
I don't mean is it okay. I mean is sort of clear until we get further clarity.
Chair, my understanding is that we're not making a decision here to just go and hire more staff or bring on additional resource. We're not. But something along those lines will come in September. Am I right?
Yes, that will come as a cost implication of undertaking the audit work when the full consideration of the terms of reference are available.
Okay, well, I'm happy to propose that then.
And I'll second it, Chair. Alderman Morris Devaney.
Thanks to both of you, and I don't have any other persons down to speaker, so I assume people are content enough to go forward on that basis, if that's okay. Members, the next 9 items are open for information. There's different aspects on there, but they're open for information. But obviously, if people want to address any of them, if I give people a minute or two to put it in the chat box, then we can see what we're dealing with, and whatever. That's okay. if we could have Michaela Boyle in terms of item 17.
Chair, do we have Alderman Hussey before me? No? Yeah, I read that one.
Sorry, Michaela, my apologies. Just give me another 10 or 15 seconds to see if anybody else is coming in, because there's Councillor Farrell, Rory's on there in item 15.
I have no problem with you going ahead of me, Michaela.
No bother. On the
Okay,
chairs and
without, could I ask Rory Farrell to come in first, please? Councillor Farrell on item 15.
All right. Cheers, Chair. Obviously, it's regarding the mental health strategy that has now been approved by the Health Minister. It's comprehensive in nature and it's ambitious in approach. There's 35 key actions on there, and if they're all delivered, it'll transform mental health services and mental health outcomes across the North. What's really useful, but also really concerning, is that the mental health strategy has a funding plan attached to it, and it's envisaged that over the 10 years that 1.2 billion is going to be required to fund all the elements included in the mental health strategy. So words are important in terms of the strategy, but in our view, a dedicated funding model needs to be agreed to make sure that all the key actions in that mental health strategy are actually delivered. And I think it's up to all political parties to work together, to cooperate, to make sure that that becomes a reality. But I would like to thank Robin Swan for producing this strategy and all the other stakeholders. He's a minister that's clearly read the New Decade, New Approach document and realises what his commitments are. So well done for doing that. Thank you.
Thanks, Rory. And if I can ask Councillor Boyle McKeel to come on item 17, please.
Yeah, thank you, Chair. And maybe, Chair, with your indulgence, can I just make a comment on item 15 on the back of Rory's comments? And just to say, I totally concur with everything that he has said in terms of the mental health strategy. But just to ask maybe Karen, I think maybe at this juncture it might be appropriate, if it hasn't already been done or requested, to maybe bring Professor Siobhan O'Neill either to committee or council. I do know she does come to council every quarter to another forum within council, but maybe to come and brief this committee just about the mental health strategy locally and what the problems are locally in terms of a strategy going forward for Derry City and Strabane District Council. So if with members' indulgence, if they would agree with that, on me to bring Professor O'Neill to the committee at some stage in the autumn, if it hasn't already been requested. Karen?
Karen?
Is that okay?
The most recent contribution, Councillor, as you've alluded to, has been through the Civic Forum. She also attended the working group in terms of giving some input to members of that group as part of our response to the mental health consultation strategy. But if the committee wish, I'm happy to extend the invitation.
Okay, people, folks, okay with that?
Thank you. Yeah.
Okay.
And just item 17, Chair.
Yes, please.
Yeah, thank you, Chair. I just want to, obviously it's the Melvin Arena, and I just want to, at this juncture, pay tribute to Karen and her team for all their efforts to endeavour to bring this project to fruition. At times it hasn't been easy, but I do know that every effort was put in place to get the project over the line for all user groups across the Strabane district area and indeed the Derry and Strabane area. Tomorrow we do have the grand tour I call it our mini stadium. I don't know, others may call it something different, but I do know that the people in the area are appreciative of the efforts that the council went to assist them with their concerns throughout the whole project. And I want to put it on record that indeed I, as a councillor for the area and as someone who lived in the area, it's great to see it to the potential it has today. And I'm looking forward, like others, to the tour tomorrow. And just to say once again, to thank you, Karen, personally, for your work and your team and the work that was involved behind the scenes. And as I said, not easy at times, but we brought the project to where it is now. And it's a project that we all should be proud of. And I know everybody across Strabane is very, very proud of what we have achieved with the Melvin area, and onwards and upwards with it. Thank you, Karen.
Thanking you, Michaela. Councillor Edwards, Stephen.
Chair, thanks for letting me in, and like the previous speaker, Councillor Boyle, there, I do welcome this development and all the effort that all the boards and councillors and the council team have put into it. It's great for the wider Strabane area. And on the report as well, I do welcome the activities that are coming up. It is disappointing that we didn't get the summer camps in there. I've raised that before, but I do welcome these activities that are coming up. I just have a general question, Chair, and I'm just wondering, I know that a few months ago we had a report on the committee about the boxing part of Melbourne, about a boxing club being set up. I'm just wondering, is there potential for an update on that? And that might be one for Barry. Thank you, Chair.
Okay, Stephen, thank you. Barry?
Through yourself, Chair, yes, that's progressing, Councillor Edwards. We have received a letter of offer from Sport NI. We still have a number of hoops still to jump through in terms of the technical documentation and all of the rest, but yeah, that is progressing. So the next steps will be one with our project management team. So that's a project that, you know, we will have to look at it in light of COVID and recent increase in costs in the construction market and all of the rest. But you know, good news in that. I think Karen maybe did update at the last meeting or one of our meetings in terms of the letter of offer coming through. So things are progressing well with that. Yeah, Chair.
Okay. Thanks, Barry. Moving on, folks, to item 19. Alderman Hussey, Derek.
Thank you, Chair. It's really just a few observations, and I suppose it follows on from the previous item, reference Melvin, and of course it's to be welcomed. I think the report says 1.7 million on a project that will have a lifespan of what, 15, 20, 25 years. A good investment in capital infrastructure in Strabane. Item 19, the city baths. On 2.2, the surveys, the M&E survey and the structural engineering survey. A couple of questions really. Is there a costing on how much those surveys were? Moving then to the 600,000 budget for a period, can we be reminded of the reopening? How long is this 600,000 covering? I mean, is 1 year, 2 years, 20 years like the Strabane project? And in light of the comments that Barry has just made, is it likely that that cost is going to go up with materials, etc., as he highlighted there with regard to the boxing club issue in Strabane? And finally, on 3.1, I note there work has been regressing and there are 4 areas. Has there been any expenditure on that? So I suppose, what expenditure was it there on the surveys, the M&E and the structural? The 600, is that likely to go up? How much more has been spent on 3.1? And indeed, the issues revealed, re asbestos and structural and pipe work, etc., on 3.2. So, I suppose a figure, what are we looking at an overall cost here and what period of time? And when I've got that answer, Chair, I'd like to come back just with a supplementary. Thank you, Chair.
Thank you, Derek.
Thanks, Chair. Thanks, Alderman Hussey. With regards to your two questions around costs, particularly section 2.2 and 3.1, we're providing this as an update via information. We'll gather those details from the Environment Directorate. It's the property team and Conor Kelly's team who are leading on these specific work. So we'll get those questions answered for you. We wouldn't have those details in front of us at present, but we'll get those for you. In terms of the cost, we had a project board meeting as of last week and one the week before, and we've been advised that the budget remains 600,000 to carry out the essential works in order for the building to reopen. As you'll see, and you've mentioned yourself, within the section 3 there are further pieces of work to undertake, and then that will be fed into the project board. So if there is any increase in cost, obviously it will go in front of committee for approval, but the indications are at present that we will be able to carry out all of the works within the existing budget. With regards to your, I think it was your first question on the timescale, the timescale remains as advised previously, that there'll only be a guarantee by engineers, just because of the pure age of this building alone, that it will give us another lifespan of 2 to 3 years. That may be longer, but at this point in advance of the works, there can be no guarantee outside of that timescale. Thanks, Chair.
Thanks, Barry. With your permission, Chair, just to make comment, the 600 plus, let's add 100,000 to that for the surveys and other issues that will arise for a period of 2, maybe 3 years. I'm just mindful of how many play areas throughout our council area that could have accommodated, and they would have lasted a heck of a lot longer than 2 to 3 years. Thank you, Chair.
Thank you, Derek. And folks, have 3 further speakers in this. If I could start with Alderman Kerrigan. Keith, please.
Thank you very much, Chair. And to be fair, I'll give Alderman Hussey credit there, because he's kind of again took the one out of my sails. I was going along the same lines there. I was seeking, I did state a period on that point, but it was from what I recalled when it was raised at the previous meeting, it was a 2 to 3 years. And I was going to ask the question: was the potential cost still holding at 600,000, or was it to be increased, or was it likely to increase with it, as has been stated, with the surveys that have taken place, and again with the rise in price of materials and availability of contractors as well to take on such works. But again, the question's been asked by Alderman Hussey, and the answers have been given. But again, it is stating, when we were looking previously there at a few 12,000 to fund and to assist community groups, still seems a pile of money being spent there in that one project, when there's only a 2 to 3 year lifespan out of it. It does seem, it doesn't appear, very difficult one to sell, particularly in the rural end. Very, very difficult one to sell. Thank you, Chair.
Okay, Keith, thank you. Councillor Mooney, Sean.
Thanks, Chair, for that. Just a note the comments of Alderman and Alderman Kerrigan, but although being a waterside councillor, I've had a couple of people contact me about, is there any indicative date for the potential opening of the city baths? I know that I've read the report, note the comments on it, but really what I've been asked is there any indicative date when the baths will be reopened after the work completed?
Thank you, Sean.
No, through yourself, Chair. The indications are, as has been listed in the report, early 2022. The contractor obviously won't be appointed to September, and then they will provide their detailed project programme, and there'll be regular updates at project board meetings. So that is the information we have at the minute. But when we have a definitive date and a project timescale, with a bit of buffer, we'll let elected members know that straight away.
Thank you, Barry. Councillor Burke, Tina.
Thanks, Chair. Just very briefly, it's just in relation to this. I'm happy to see the work progressing in Wyndham Street and the City Baths, and look forward to it reopening. I appreciate and take on board some of the previous comments around costing and stuff, and it is a significant amount of money which has been debated in this chamber numerous times in the past. But when you look at then in terms of the social value that this City Baths gives the people who use the pool, like local schools, clubs, families, that can be hard to quantify. So in comparison, just to briefly said, I'm happy and thanks for the work done they did on it. I know a lot of people who've contacted myself who are keen to see it reopening and look forward to getting the work done. Thanks, Chair.
Thank you, Tina. Councillor Harkin, Sean.
Thanks, Chair. Yeah, on the City Baths. Look, I think that my understanding is that the goal is to see this, you know, that the City Baths will, the renovations, the rehabilitation of the building will see this used for 6 or 7 years. And my hope is that we'll see it used for a lot longer than that, because I don't think the need for it will disappear in 6 or 7 years. So it is an expense for the council, and I think what we have to do is hopefully move this forward as quickly as possible, and then from a council point of view, you know, make sure we get the maximum usage out of it as possible, and that means doing the work then to get, you know, to get it used by as many people as possible, and we know that, you know, there's lots of people who are very eager to get back into it and use it for a range of different purposes. So yeah, I you know, I don't think sometimes that the kind of, you know, argument this is getting funding and that's not getting funding works. I think we have to fight to see as many things funded, whether they're in the rural areas, whether in the urban areas, and I think we should be trying to make, where there is a need, I think we should be trying to make a united push. Because just on play parks, look, it's a bit off topic. I know there's rural need, but there's lots of areas in the urban areas too that want play parks that aren't actually included. So I think we have to identify that and then be honest, and then try and fight for as much resources for our district, for everybody that's in it, right across the board.
Thank you, Sean. Okay, folks, unless I have missed anybody, that's all the people who are down for matters of information. And if people are happy, could I ask for a proposal to get into confidential, please?
So proposed, Chair. Alderman Devaney.
Thank you, Morris. Seconder, please.
Carl.
Here.
Michaela,